Good morning, everybody. Welcome. The troopers in the room. Right? We're the hardy New Englanders here. All right, we are going to start off this beautiful morning by doing the Pledge of Allegiance. So won't you rise with me?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So as you can see, Chair McDonald is navigating these streets. He will be here shortly. He is the prime sponsor of this bill, and Representative Weber has kindly offered to introduce it on his behalf. So Representative Weber.
Thank you, Madam Chair. My name is Lucy Weber. I represent Cheshire 5, which is the towns of Surrey and Walpole, and I am here as a courtesy to our chairman to introduce House Bill 1337, repealing the New Hampshire Council on Autism Spectrum Disorders. And with that, I am going to end my remarks and take no questions and allow those who have signed up behind me to speak, and then when Representative McDonald gets here, he can put in his part.
Thank you. Thank you, Representative. Okay, I'm gonna multitask and try and do the timer and everything here, so bear with me. So, oh yeah, that would be wonderful. Thank you. Okay, so first we have up to speak Kelly Earhart, and you have 3 minutes. Thank you. Thank you for your testimony as well, your written testimony.
So I press this button here, or is it already on?
It's already on, so you're set.
Okay. Dear Chairman McDonald and members of the Health, Human Services, and Elderly Affairs Committee, my name is Kelly Earhart. I live in Nashua. I am very opposed to HB 1337. As a person with autism and mental health needs, I believe it's important to have a council that is working on the things I need to be productive, interdependent member of my community. I would also like to be a member so I can advocate for others like me. The council has nominated me to the governor for appointment, but I have not yet received an appointment since my application in late 2025. I was diagnosed with autism spectrum disorder at the age of 12. However, I didn't receive any developmental disability services until 2014 when I moved to Nashua and was told that I could be eligible for the developmental disability waiver. So at the age of 48 was the first time I began to receive services through the New Hampshire Developmental Disability Service System, and it has made all the difference in my quality of life. I believe that having access to information and resources about my autism diagnosis earlier in my life would have benefited me greatly. Even though I was not receiving any services, I believe my career would have been more established by now if I had better understood my autism and how I could use my strengths to accomplish my goals despite my diagnosis. I have attended several Autism Council meetings on Zoom recently. I'm interested in becoming a member so I can represent people like me who have autism and may not realize what resources are available. However, due to my disability, I can only attend remotely and also due to financial reasons. Nevertheless, I feel I have a lot to contribute and want to serve on the council to help others like me. I'm also a member of the New Hampshire Developmental Services Quality Council, so I know they do different things than the Autism Council since they only focus on the developmental disability and adult brain disorder waivers, which not everyone with autism has access to because they may have lower support needs, so they do not qualify for those services. Please do not pass HB 1337. People with autism need to have a public body to advocate for information and resources that can help them. I cannot join the Autism Council and be a voice for the voiceless if it is abolished. Sincerely yours, Kelly Earhart. Thank you.
Thank you. Are you taking questions?
Sure. Do you have any questions?
Let's ask.
Okay.
Yes. Representative Nagel.
Thank you very much for your testimony, and thanks for taking my question. How often does the council meet now?
Monthly.
Monthly? And can I ask a follow-up?
Yes,
Sure.
follow
How
up.
many people typically attend the meetings remotely or in person?
I would say it's more by in person, and then it's more less remotely. I wouldn't really have an answer on how many people attend remotely because I would say I attend remotely mostly, and I'd say 5 or 6 people attend in person. We meet in person in Concord at a school board or a school. And the reason that I don't attend in person is because I don't drive and I don't have a car due to my autism. And it costs between $50 to $80 one way to get on Lyft or Uber. So that's cost prohibitive for me to be there. But once I'm appointed by the governor, I will be required to be there in person because I'll have to count towards quorum. Does anyone else have any other questions?
Thank you.
Yes,
very
thank
much.
you.
You're welcome.
Are there any other questions? I actually have one real
Okay,
quick.
sure.
And how often does the council meet?
Monthly.
Monthly, okay.
Fourth Friday of the month between 12:30 and 2.
And it's always well attended?
Yes.
Okay. Thank you. Thank you
You're
for your
welcome.
testimony. All right, next we have Virginia Cannon. And you've indicated 5 minutes. If you could keep it to 3, that'd be great.
I will do my best.
Thank you.
I don't really prepare ahead of time because I like to listen to what previous people say and not be repetitive. So I'm sorry I don't have written testimony for you.
Okay.
So I am also on the spectrum. I did not know or understand anything about autism until my child was diagnosed. And then the person doing the testing said, "Mom, can I have a word with you for a minute, please?" And all of a sudden I was like, "Oh, wow, that explains so much." In any event, I am a member of the Autism Council, appointed by the council. I'm the only person on the council that was appointed by the council. That was a law that was passed several years ago to allow for that. And I've been on the board for 5 years, I think. So part of the problem that we've had, and part of the problem with the group of people that's pushing to have us terminated, is that they say we don't do anything. And on one level, that's correct because we've had a very hard time meeting quorum. The people who are on the board are either appointed by the governor, which has not happened in years. The governor can't seem to get around to appointing a representative for the governor's seat, the Department of Education, Department of Oak Rehab, or the people that we've put forward to please have individuals who are on the spectrum and or their family members appointed to the council. Their names go up in nomination and they just sit there. And we've had intense discussions about whether those people, having been appointed or being nominated by the council but not appointed by the governor, do they count towards quorum? Do we have to count them towards quorum, or don't we count them towards quorum? Or do we have quorum today because they're not here because they can't vote? And then a lot of the people that are on the board are professionals that work for the state or work for other organizations who volunteer or are, I don't know whether it's part of their job responsibilities, but most of the people can't take the time to do it. I don't know why. I don't know why they're on the board if they're not willing to take the time out of their other job to do this. But for a very long time, they didn't come. We now have a group of people that are working really well together. They come, we have quorum, we manage the business. We're in another one of the arguments that I've seen on Facebook is that we don't have a annual report. We haven't done an annual report. Well, we haven't had a quorum to be able to even put together a committee to start the annual report until recently. So we now have an annual report. We're supposed to vote on it in 2 days to get to you guys. But we've been effectively, I'm sorry. Do you want me to stop at that point?
You can just
Okay,
stop. Yep.
we've been effectively stymied in the process of doing what we need to do because we haven't been able to meet quorum to meet the 91A requirements to do what we're appointed to do. We just, I mean, for a very long time, we couldn't even meet because we didn't have quorum.
All right, thank you. Thank you
I'm
for your
happy to take
testimony.
any questions.
Yes, Representative Nagel.
Thank you, Madam Chairman. Thanks for taking my question. I'm on a number of councils and whatever, and I totally understand the challenges you're facing. With the changes in quorum in terms of allowing remote participation, has that improved your ability to achieve quorum?
Absolutely it would, because professionals could come from their office and Zoom in, and that would count. But we have to have it in person, 1/3 in person. And unfortunately for a lot of people who work in Concord, and I don't quite understand, we're meeting at the Concord School District board meeting room. The Concord School District has graciously offered us to use their room because they have an owl, they have the ability to put it up online and internet. But lots of the people that are appointed to it just can't seem to make a commitment to come. Although that's changed because a lot of those people were removed and new people were put on.
Can I ask oh, sorry.
Yep, follow up.
A lot of these councils and committees and commissions may not meet quorum, but it doesn't mean they're not doing something. Are you guys doing something?
Well, we are. I mean, one of the things that we recently finished was helping Department of Motor Vehicles do the Blue Envelope program. We met, I want to say 5 or 6 different times to discuss what that should look like, what some of the concerns were. For example, Division of Motor Vehicles was strongly encouraging people to put their driver's license in the blue envelope. When we strongly discourage that because a lot of the medications that people who are autistic are on require your driver's license to get your medication. So you need to have it with you when you go into the pharmacy to pick it up. So we're like, no, I mean, kind of things that I don't think Division of Motor Vehicles even thought about that because it's not their experience.
Thank you. Any further
other
questions? Yes, Representative Polozov.
Thank you, Madam Chair, and thank you for taking my question. So, in previous testimony, we heard about different activities that support community. So, we heard about working on issues, advocating for services, informing about services, providing services. So, as far as I understand, council itself does not provide the services, but in terms of like, can you clarify like what council can do and what it and where it relies on other providers?
Wow. Okay. I will try. I'm not the chair, but I will try. One, I will say that we did try to pull together a webinar for families and members on the spectrum recently, and we're involved with Ross Green's Lives in the Balance in Maine to try and bring an online webinar for people about how to manage emotional overwhelm and particularly when your kids are difficult to emotionally regulate. And we had some money in our funding, but we were told we weren't allowed to use it for that. We could only use it for administrative purposes. We were not allowed to use it for direct services to members of the community. What we do is a very high level, and what we're doing right now is a very high level discussion between, let's say, the head of Medicaid. What's happening with Medicaid changes that affect people that are on the spectrum, both people who are receiving services or people who may just be receiving straight Granted Advantage or straight Medicaid. What's coming down the pipeline for changes? What do those changes look like? What's the timeline so that people who are heads of organizations that actually provide those services have a heads up and can notify caseworkers or individual family members? And or we had a presentation from and I may get the name wrong, but the group that does augmented assisted communication and what kind of services they have so that we can take that back to our local communities and spread the information about what's available. What if you're not completely verbal? How can you support communication and what's available through that particular organization as services and resources? Does that answer your question? Okay, thank you.
Thank you. Yes, quickly, thank you.
Thanks again for. So you just pointed out something really important. We have a network of providers in the state. Do you see yourself as a role of facilitating communication between the state and individual agencies within the community?
Well, there's a lot of intercommunication between, we have someone from Medicaid, financial services. We have often Jess Gordon comes to the meetings, whether in person or virtual. So there's a lot of communication between the people who work for the state who are there and the people who work for service providers, as well as people who work for area agencies, nursing association. I think, I mean, I came into the council well into its teenage years. I think that was the point, looking at the legislation, I think that was the point, was to have those communications back and forth of what's going on and what's available, and how do we get that information down? How does it trickle down to the people who need those services, that service or that information, so that they can access the services that they need?
Thank you. Yes, Representative Polozov.
Thank you, Madam Chair, and thank you for taking my question. I don't know if you're the right person to ask, but
I'll do my best.
We call it spectrum, so there are different conditions that go in, but I hear some concern in the community about federal push to investigate potential some toxicity being connected with autism. So does council have any official position on what's going on with federal MAHA movement, if you know what I mean?
The federal, you mean creating a list of people who are autistic?
No, not list, but in investigating if some medications can have side effects of being autistic. So we're hearing some back and forth on these issues. So I wonder if council have any position on federal push to investigate some medical side effects potentially contributing at least to some cases of autism.
Okay, I think I understand what you're asking. I don't believe that the council as a whole has voted to take a position. I think the people who are on the council have their own personal viewpoints about that. But I don't know that we as a council have voted to take a public position about that. If we did, I wasn't there for that meeting, and I think I've been to all of them.
Thank you. Any further questions? Seeing none? Thank you.
Thank you.
All right, I see the prime sponsor has entered the room. Representative or Chair McDonald, you are welcome to come forward and speak to your bill.
Well, this is what it's like down at this end. My apologies, Madam Chairman. All of you either had better roads, less snow, or better driving conditions, or less traffic. I'm not sure, but my apologies for being late this morning. Everything was great till I get to the Concord City line, and then there was a long line of traffic not moving. So despite my best efforts, I apologize again. So good morning, Madam Chairman and members of the committee. For the record, my name is Wayne McDonald, and I have the privilege of representing Rockingham County District 16, which is the town of Londonderry in the New Hampshire House of Representatives. Representative Weber, I guess you've already introduced this? Or?
All I did was start the proceedings, so I have said nothing about it.
No, I
mean, you can just start all over.
But thank you for enabling it to begin. Let me be, at the beginning of this, at the outset, let me say that I approach this matter and I introduce this bill with no disrespect to the challenges posed by autism and spectrum disorders, but rather the opposite. The council is not meeting its responsibilities to those it is meant to serve. I heard the earlier testimony. That's encouraging, but it is, and I'm not, it's good to, I'll just leave it at that. That's good to hear. But my testimony is based on other conversations I've had and other feedback I've received. As someone who's been involved, myself, I'm talking about now as someone who's been involved in public service in New Hampshire state government in 2 of the 3 branches for nearly 3 decades, I know that government can work. And when it works, it can, should, and usually does work well. We hear that there are too many boards, study committees, commissions, councils, and so forth, and there are. However, if they're all doing their job and meeting their responsibilities, I have no problem seeing them continue. However, when the very people and families for whom a body is created is not meeting those responsibilities, then I believe that it's time for it to be dissolved. The council was formed in 2008 by this very committee, Health, Human Services, and Elderly Affairs, under HB 1634. Its purpose was, and I quote, to make recommendations on the care, treatment, and quality of life of children with ASD and their families, unquote. The statement of intent of the bill went on to say, and I quote again, addressing the complex multi-system challenge of ASD will require ongoing collaboration among the medical, education, and human services systems with parents and individuals with ASD, unquote. The council was required to report annually to the governor and the legislature. Since that time, families with ASD have grown increasingly frustrated and felt ill-served by the council. A couple of those families may be represented here today. Despite the expectation that the council would report annually, no annual reports were issued between 2017 and 2025. As of 2025, the council had not met since 2019. While that may be understandable up to a point due to the pandemic has been over for a number of years now. Efforts have been made in recent days by experienced researchers to locate reports the council may have issued. These efforts have been unsuccessful. If such reports do exist, they certainly should not be this difficult to find. It is a public body. Last year, an effort was also made to repeal the council. It was noted that the work it was supposed to be doing was already being done, at least in large part, by the New Hampshire Developmental Services Quality Council. The effort was successful in the House to repeal it, but failed in the Senate. When I mentioned that I was introducing this bill to one of the senators who had opposed the repeal in 2025, back during the LSR filing period for the current legislative year, that senator agreed that the matter should be reconsidered, and I think so too. For all of these reasons, colleagues, I ask your consideration of ought to pass on HB 1337, and I will take any questions.
Thank you. Are there any questions? Yes, Representative Polozov.
Thank you, Madam Chair, and thank you for taking my question. What objective measures can we use to decide that council doesn't meet its obligations? And specifically, we heard that maybe in 2 days they will finally vote on the yearly report. So should it happen, and should we have an annual report from the council in 2 days, would it mean that they are back to what they were created for?
Well, I'm wondering if all of this recent activity is motivated by the fact that I filed this bill and they're facing potential repeal. I don't know if they're back. I would like to think that, particularly if this bill is not successful, that they will continue and that they'll get on a regular pattern and start doing what they're supposed to be doing. It's encouraging that it sounds like they're going to be meeting and maybe that report will be issued. But again, why hasn't that occurred? I heard quorum issues. Again, the pandemic may have been another reason, but we're talking about something that went on for years, and all of this activity seems to be only since this bill has been filed. And we shouldn't have to file a bill to have bodies, various government bodies do their job. That would be my thought.
Thank you. Representative Weber.
Thank you, Madam Chair, and thank you for taking my question.
Sure.
Would it be possible that, as we heard last year when we heard this bill, that the council was working on all of the issues that had prohibited it from meeting effectively prior to last year? And given that we heard testimony that they have in fact been meeting regularly and are about to finalize an annual report, is it possible that it is not just because you filed this bill that they are now actually managing to reconstitute themselves and work effectively?
If the question is it possible? It's possible, sure.
Thank you.
Anything's possible.
Thank you. Any further questions? Yes, Representative Lamontagne.
Thank you, Madam Chair. Thank you for taking my question. You said that you thought the New Hampshire Developmental Disabilities Council, I'm not sure I got that name right,
Okay,
has
right.
been working on some of these issues. Can you be a little more specific about what they've done regarding autism?
I can't. No, I'm that back in last year when we were addressing it at that time. There was some research done, and unfortunately, I don't have that with me. But and I'm not saying they totally coincide with the Autism Council, but there's a great deal of overlap, as I understand it.
Thank you. Representative Kesselring.
Thank you, Madam Chair. Thank you for taking my question. So I'm thinking about this from last year and also from perspective. Would it be easier just to resubmit or redo this bill to make it so that if they don't meet their statutory requirements, that their committee sunsets and disappears if they don't meet these?
That could be a possibility, sure.
Thank you. Any further questions? Seeing none? Thank you, Representative McDonald.
Thank you, everyone.
All right, next we have Isadora Rodriguez. You indicated 2 minutes. That would be amazing, as we are now running behind.
Good morning, everybody. In the interest of brevity, I'll just introduce myself, and since we're doing a history lesson here, I'm happy to jump in. So my name is Isadora Rodriguez Legendre. I serve as the Executive Director of the New Hampshire Council on Developmental Disabilities. Through my role as the Director on the DD Council, we hold a seat on the Autism Council. We also hold a seat on the New Hampshire Developmental Services Quality Council. So I can speak to some of the differences and some of the lack of overlap that this council actually helps and hopes to address. So I want to point out just that the Autism Council did hold 4 meetings in 2024 successfully. We began to meet consistently in 2025, and actually the second page attached to my testimony is the original bill language that was requested by the Autism Council last year. The original bill language was not to repeal the council, it was actually to enhance the ability for the council to do its work efficiently. And that includes issues with appointments being delayed and whatnot. So, and I do agree that the pandemic had a significant impact where parents and families had to drop everything, and public bodies, volunteering on public bodies was no longer a priority. Their families were the priority. And so the leadership of that council was made up of family members, unfortunately, and with no administrative support at the time, members stopped coming. So a lot of the work in 2025 was to reestablish the membership, was to get the bodies that are not governor appointed to send a representative and be active and communicate and present information that would be important for us to have. So that being said, we are about to finalize an annual report. We did contribute to the Blue Envelope program last year. We have set goals as a council to collect resources and information and materials for dissemination. We've actually activated a website during the last year to be able to have all of that information available to the public. So there are a few people that say that the council, it was great before and now it's not doing anything. But I argue that it's not being given a chance to do things if we're constantly fighting to justify our existence as we really climb back from not being able to kind of have regular meetings. And so I just, again, would like to have people review the original bill that was submitted last session around the Autism Council, because it came from the council and it was a bipartisan bill and it was to strengthen, not to abolish the council. The amendment was what made it an attempt to abolish the council.
Thank you.
Sure.
Thank you. Are there any questions? Yep. Yes, Representative Weber.
Thank you so much, and thank you for taking my question.
Sure.
So, would it be fair to say that your position is that what you would like us to do is simply to adopt the bill as it was set in last year? Is that what you would like?
That would be
on behalf
ideal.
of the council?
So I'm currently serving as the vice chair of the Autism Council. The chair has also submitted testimony. Unfortunately, she could not be here today. I suggest you look at that because she cites legislative mandates that we are meeting through 91A, 171A, which is our enabling legislation. And yes, we would still like to be stronger. We would still like to serve families. We would still like to be able to collect and disseminate information and resources, hold trainings, and really address the needs of people with autism that those other councils and commissions do not address. In part because there are a lot of people, again, who are receiving late diagnosis of autism, who don't qualify for Medicaid-funded developmental services, but still have significant needs that relate to getting employment, receiving appropriate education. They still need information and resources, but they don't always qualify for the Medicaid waiver to allow them to access developmental services.
Thank you.
Sure.
Any further questions? Seeing none.
I'll think of
okay.
it.
Representative Kesselring.
Thank you, Madam Chair. I do have a quick question. I'm having trouble reading this.
I know, it's so
my
small.
eyes, but so it looks to me like it's repealed the section, but I don't see in it the requirement for the annual reporting. Is that repealed in this? Because it looks like in the statute that's in there, but then this says repealed and repealed.
So I believe that we were not looking to eliminate the requirement for an annual report. I think annual reports are an important way that we demonstrate the role and function and viability of a council or commission. I don't have my glasses. I can't also read the details, but certainly it's not something that is a deal breaker. I think that the council is very well positioned to have an annual report. And being that about 2/3 of the council are not governor appointed, we have had no issues meeting quorum lately, just so folks are aware.
Yep. Follow up.
Just a quick follow-up. So could you elaborate on why a report hasn't been filed from your perspective?
Sure. So from my perspective, again, the entities that were that value this body, right? The New Hampshire Council on Developmental Disability is one. CSNI is another. There are representatives here today that have interest in joining the Quality Council. However, there was an issue of administrative support. So there's no one providing administrative support, despite the law saying that the department must provide administrative support. And so we were having trouble getting the people there, notifying, providing appropriate notice of meetings, location. We had to get a location. We had to get an owl to be able to do the Zoom thing. Like there were a lot of kind of administrative things that needed to be addressed first before we could actually do the work of that would go into an annual report. And the annual report does reflect some of that in it. And again, it's to be voted on Friday for public dissemination. So I'm happy to share a copy with all of you once that happens.
Great, thank you. Representative Politov, did you have a question?
Yeah. I just want to clarify that last page on 4E, it's like first line from the bottom. It does talk about annual report.
Is that your question?
Thank you.
Oh, okay. All right. Yes, Representative Weber.
Thank you, and thank you again for taking my question. I was struck at an earlier hearing when a member of the autism community said to us that people who are on the autism spectrum simply have a different operating system from those who are not on the spectrum. And I wonder what your opinion is about whether the fact that people who are on the autism spectrum both see the world differently and operate within it differently might be one of the reasons that we are having trouble making this council fit our usual definitions of how councils do their work.
That's a great question. And I would say my opinion is that, I want to be careful here, is that, autistic individuals, many of them can advocate, you heard from a few of them today, and have really strong voices. They want people to understand what their operating system is, or at least not to get in the way of that, right? And there are other folks that advocate for people with autism without actually being autistic themselves and have the best interest in mind, but don't always, again, give the voice to the folks that are being directly impacted. One of the reasons for the previous change in legislation that was mentioned earlier was to add up to 5 individuals, members at large, from the community to bolster, to better inform the expertise around what it is like to be autistic on the council itself. And so those are unfortunately the seats we're having trouble getting appointments for, but there are many people that are attending regularly, even without having been appointed, because their names have been put forward to the governor's office.
Thank you. Any further questions? Seeing none, appreciate it.
Thank you.
Okay, next we have Adam Thompson. You've indicated 2 minutes as well. Thank you very much. Okay.
I'll try to just read it fast.
Sorry?
Make it a joke. I'll try to just read it fast.
Thank you.
Good morning. I appreciate the opportunity to address you today, honorable representatives. Thank you so much. My name is Adam Thompson. I'm from Scenic and Historic Ward 3 in Nashua, and I'd like to ask your support, to oppose 1337. The Council on Autism and Spectrum Disorders provides an important structure for coordination, expertise, and lived experience input across systems that affect autistic residents and their families across the Granite State. And I'm very happy to hear that the council is now meeting its responsibilities after the quorum issue has been resolved and is in the process of submitting their annual report presently. The autism policy touches education, healthcare, employment, housing, developmental services, and the Blue Envelope program, which saves lives. The council helps inform state agencies and legislative bodies so they can understand real-world needs, service gaps, and policy impacts that are affecting autistic residents and their families. Without a dedicated advisory body, that coordination risks becoming fragmented. And advisory councils are not symbolic. They create a formal pathway for families, self-advocates, clinicians, educators, and service providers to inform policy decisions and identify gaps before they become crises. Eliminating the council removes a consistent mechanism for that input at a time when demand for autism-related support continues to grow. Many individuals on the spectrum navigate complex service systems throughout their life. And a centralized advisory body helps ensure policies are responsive, aligns by their informed real-world experiences. Repealing it would reduce visibility, accountability, and collaboration across state agencies. This bill also raises a broader question. How New Hampshire families and folks with autism how the state will ensure that autistic residents and their families continue to have a structured voice in policymaking. If improvements or restructuring are needed, those conversations should occur with stakeholders at the table, not through the elimination of the form itself. For these reasons, I respectfully urge the committee to find 1337 inexpedient to legislate. And again, I'm extremely happy to hear that the council is now meeting its responsibilities after the quorum issue has been resolved, and they are submitting their reports presently.
Thank you.
Thank you.
Are there any questions? I am seeing none.
Have a wonderful day.
You too, thank you. Next we have Shannon Bouchard. Morning. You indicated 2 minutes as well.
Yeah, I'm just gonna read
Okay,
from my notes if that's okay.
absolutely.
Okay. If I can get on my notes. Okay. Good morning, members of the committee and Lady Chair. My name is Shannon Bouchard, and I'm here to support the repeal of the Autism Council. I'm speaking today not as a policy expert, but as a parent who lives autism every single day. Families like mine don't experience autism in meetings, bylaws, or advisory reports. We experience it in schools, in medical offices, and in the constant struggle to find real support in the system. I have attended council meetings over the last probably 4 years. What I saw was not progress or accountability. It was repetition. The same conversations, the same promises, and no measurable outcomes for families. Meetings were often canceled, and quorum for voting was defined as just 9 members. This allowing major decisions to be made by a very small number of people on behalf of the entire autism community of New Hampshire. This council does not provide direct services, so no families will lose supports if it is repealed because families are not receiving supports from them as it is. When I requested information about how public funds were being used, I received pages that were heavily redacted or entirely blacked out. That is not transparency. That is not what families were promised when the council was created. Meanwhile, parents are still waiting for services, waiting for help when navigating the systems. We are waiting for some accountability. If a council exists mostly on paper, consumes public funds, and does not improve outcomes for the people it claims to represent, then it is not serving its purpose. Repealing this council does not mean abandoning autistic individuals or their families. It means acknowledging that this structure has failed and making room to build something that actually works. Something new that will center families and deliver real results. I respectfully urge you to support the repeal. Thank you for your time.
Thank you. Representative Polozov.
Thank you, Madam Chair, and thank you for taking my question and looking deep into this issue. But I'm not sure if I follow you on funds. Previously we heard that if we are talking just about funds that council receives, previously we heard that those funds are just for administrative purposes and they just do some advisory work for other bodies that do some support or advocating for this community. So I'm not totally sure what were you expecting in financial reports and like what could be there and what could be hidden by reduction. I'm not completely sure if you.
I'm not sure either. Like I said, pages were just totally blacked out. And for public counsel, when you're requesting public information, you should be able to see what the money is going to, whether it's administrative cost or buying a Zoom account. We should be able to see that.
Thank you. Representative Markell.
Thank you, Madam Chair, and thank you for taking my question. Okay, I'm concerned about what was blacked out and the requests you had just made. Could you please elaborate on that for us?
All I requested was for the funding from 2021 or 22 to present. And it was, like I said, almost all of the pages were just blacked out.
Okay, follow up?
Yes, follow up.
Thank you. It did not in any way, shape, or form relate to personal details of any one individual
No.
or anything?
Like I said, it's just totally blacked out.
Okay, thank you.
Thank you. Representative Weber, do you, I think, okay, so Representative Nagel.
Thank you, Madam Chair. Thanks for taking my question. Thank you for your testimony. I'm just curious, you outlined a lot of goals that you would like to see us accomplished. Is there a structure that exists now to achieve those goals, or do we have to start all over?
I feel like we need to start over because what the council was created for, even though they were not meeting regularly, in 2022 they were able to bring legislation forward, and that legislation removed a lot of the gubernatorial members, so that now it's members electing members, which is a lot of gatekeeping, and parents are not being represented in the council anymore due to that.
Thank you. Representative Kesselring.
Thank you, Madam Chair. I don't know if this is a specific question, but to the committee, I know before in the past we've actually asked the researcher to get some information, and I know Representative Markell just brought up a good point about that redacted part. I don't know if we can get the researcher to get that information to see if it would be redacted.
Yes,
for us.
we can absolutely inquire. We will do that. Thank you. Any further questions? Oh, okay, Representative Weber.
I just wanted to be sure that our researcher heard what the question was, and I was shaking head no.
I'll
But the
follow up with
question was financial information for the council from was it 2019, ma'am?
It was 2021
through
or 2022
2021
up until present that
Okay.
requested.
Thanks.
I wrote down 2021 through 25. So, yeah, thank you. All right, thank you for your testimony.
Thank you.
Okay, next we have Maura Ryan. Yep, thank you. You've indicated 3 minutes. Thank you.
Good morning. My name is Maura Ryan, and thank you for having me here. I don't have any prepared remarks because I was up until 3 a.m. trying to figure out how to get a form for guardianship off the court system. I wanted to speak on the Autism Council because I have 2 friends on the Autism Council, both of whom have told me that the council is not doing anything. They asked me to attend meetings. I did do so. When I did, I found that there were right to know violations, and in the substantive part of the meeting, there was nothing actually being done for families, which is a big concern to me. I have a son with autism who's about to celebrate his 22nd birthday, 2 weeks. Who's been in voc rehab for 8 years and has only worked on a job 1 day. I couldn't find a form on the court system. This committee used to be a valuable committee. I asked Jen Pike, who used to be a committee chair, to write in because she could give you some more thought on how to structure something properly and appropriately. But this committee is now peopled by lobbyists. And when we get lobbyists on a committee, then it only reflects the agenda of the lobbyists. And if you're going to do anything with any of these committees, you have to get rid of the lobbyists, because then it's just another platform for lobbying. That doesn't help families. That only, if you look at studies show that more legislation gets passed by lobbying groups than it does directly helping constituents. So that's a concern for me because I'm a parent of an autistic child and I'm a disabled veteran myself. But the services and the supports for lobbying groups are more substantive than they are for actual people. The committee spent a lot of money on an owl, which is in the possession of a personal individual. The meetings are held on a school campus, which is not accessible to the public. And there were many times when I asked for meeting minutes when I did not receive them, which, as you know, under 91A, 5 days. 5 days for draft minutes, not months, not years. So this committee has a lot of things going wrong with it. When Jen was in charge of the committee, she did focus groups. She did a lot of stuff that was intended to help people with autism directly. However, at this point, this committee hadn't produced an annual report, and most of the stuff is fluff. And we don't need fluff, frankly. We need results. We need things that actually help us. So I support this repeal. I apologize for not having prepared remarks. I did ask Jen to write in and give you a summary of her experiences, and that will happen, and I'm happy to take any questions.
Thank you very much. Yes, Representative Polozov.
Thank you, Madam Chair, and thank you for your testimony. Could you a little bit expand on what you mean by lobbyists? Because usually when we form something like a council, we want to invite stakeholders and representative of service organizations and like from UNH bodies that studies them and from medical society and so on. Like are all of them lobbyists or like who were you talking about?
Well, you start seeing the same people on the Quality Council, on a committee like the Autism Committee, on the State Advisory Committee. It's the same people over and over again. And I understand that it's hard to get people to volunteer because we're all crazy busy. But at the same time, that's not giving you a reflection of the actual population.
Thank you. Representative Kesselring.
Thank you, Madam Chair. And I just want to hear from your perspective what you think this council should be doing.
So from my perspective, when disability started being addressed in the 1970s, there were certain ideas about disability at that time which no longer exist. So from my perspective, you'd have to rework the whole thing to modernize it and bring it up to date, because what was considered a disability in 1975 is not today. That's a part of why they're trying to have a separate autism council, because BDS doesn't specifically represent that type of subcategory because it wasn't widely recognized in 1975. But that's not really an efficient or effective way to do it. And the way we look at disability in this day and age has changed radically. So that's kind of where I see a disconnect, because you have a historical institution which doesn't mesh with the today reality.
Thank you. Any further questions? I'm saying none. Appreciate it. Thank you for your testimony. We're about to, is there anyone out there that hasn't submitted a pink card but would still like to testify? Okay, Representative McDonald, if you could get a pink card in, that would be great. And we are going to close this hearing up and open the hearing in 1 minute on HB 117 FN.
Okay, thank you for everyone. And we are now going to open the public hearing on HB 1117 FN. And I will recognize the prime sponsor, Representative Linda McGrath, a member of our own committee. Good morning.
Thank you, Mr. Chair and members of my committee. For the record, I'm Rep. Linda McGrath from Rockingham District 40, Hampton and Seabrook. I'm here to introduce HB 1117. Public health authorities are not infallible. History makes that clear. But when we examine our most significant public health failures, a common thread emerges. They were not driven by doctors thinking independently or speaking too freely. They were driven by powerful commercial interests shaping policy, research, and public messaging. Tobacco is perhaps the clearest example. For decades, tobacco companies aggressively promoted cigarettes as safe, even recruiting physicians to endorse them. That was not free speech run amok. It was big business capturing the media narrative. Thalidomide is another example. It was heavily promoted by large pharmaceutical companies before its devastating effects were fully understood. High-dose estrogen therapies followed a similar path, widely prescribed before long-term risks were acknowledged. In nutrition, the food pyramid was not the product of neutral science alone, but sustained pressure from industrial agriculture and food manufacturers. Big agriculture shaped public guidance, and Americans paid the price in chronic disease. These failures are seen by opponents of this bill as a reason to limit doctors' free speech. I would argue the opposite lesson should be learned. In every one of these cases, harm occurred not because doctors questioned consensus, but because corporate power dominated public health policy while dissenting medical voices were ignored or suppressed. That brings us to COVID. During the COVID pandemic, some physicians faced professional discipline, investigations, and even loss of their medical license for prescribing ivermectin, an FDA-approved medication, for off-label use. In my more than 40 years as a pharmacist, I've never seen doctors punished simply for prescribing an approved drug for an off-label use. Off-label prescribing has been legal, common, and essential to medical innovation for generations. This sudden departure from long-standing medical practice should concern every legislator. Why did it happen? Well, Big Pharma had a brand new experimental vaccine to market, but the only way to get emergency use authorization under federal law was if there were no alternatives available. So it was suppressed. Big Pharma, government agencies, and the media suppressed the use of ivermectin through forced intimidation of anyone who dared to prescribe it and ridiculing anyone who took it. Whether ivermectin ultimately proved effective or not is not the central issue. The issue is why open scientific debate and physician judgment were treated as threats rather than safeguards. In 2020, the top medical journals in the world, the New England Journal of Medicine and the Lancet, both had to retract articles claiming that hydroxychloroquine, another drug that was tried for COVID, was dangerous. At the same time, we saw unprecedented financial alignment, massive government contracts, guaranteed markets, media advertising revenue, professional organizations enforcing messaging discipline, and regulatory agency working hand in glove with pharmaceutical manufacturers. When that much money moves through a system, It inevitably shapes behavior. We have learned often belatedly that pharmaceutical companies have a long history of minimizing, delaying, or burying adverse effects until they are forced into the open by independent researchers, whistleblowers, or litigation. This is not speculation. It is documented repeatedly across decades of drug approvals. Yet during COVID, discussions of adverse effects of the shots were dismissed, censored, or labeled misinformation rather than investigated transparently. That should trouble us. My concern is not about one drug, one vaccine, one moment in time. My concern is about a system where enormous financial incentives flow from pharmaceutical companies through government agencies, media outlets, medical organizations, and ultimately policymakers, all reinforcing the next approved treatment, while independent voices are silenced in the name of consensus. This is not how science is supposed to work. Science advances through questioning, debate, and the willingness to challenge prevailing assumptions. Medicine advances because doctors are allowed to exercise clinical judgment based on individual patients, emerging evidence, and professional experience. The policy question before this body is not whether we trust science, it's whether we recognize that science cannot survive when inquiry is constrained by profit and enforced silence. Physicians are uniquely qualified to evaluate the evolving research, apply it to their individual patients, and engage in shared decision-making with their patients, carefully weighing risks and benefits. Patients have a right to hear about reasonable emerging treatment options. That is why protecting free speech for medical providers is essential. Limiting speech does not protect patients, it protects power. An example from pediatrician Joel Gator Warsh, whose new book is entitled Between a Shot and a Hard Place, he states, every doctor will agree that there are valid medical reasons for vaccine exemption. Yet in California, for example, today, it is almost impossible for a doctor to give a medical exemption without losing their medical license. Who should we trust to follow the science? I would choose my local, trusted health professional who provides me with informed consent. I would also quickly like to read the testimony from a doctor who couldn't be here today. He states he's practiced in New Hampshire for 25 years. He noted in the past 5 years, overreaching federal government, medical societies, and hospital associations using the threat of censure or loss of license to silence physicians who spoke on emergent therapies that would have benefited patients, or dangers and risks of therapies that were being pushed. In my opinion, this silencing adversely affected patient care in New Hampshire. Unfortunately, there is now recognition of missed opportunities with emergent therapies and wreckage from therapies pushed that were not appropriate for individual patients. If caregivers had been able to speak freely, as I felt I could prior to the pandemic, many more patients would be alive today, and many would not be suffering from complications of therapies due to silencing of caregivers. This doctor lost his job because the hospital he worked at mandated that every patient admitted get multiple vaccinations. These patients came in extremely sick, and he said, no, I will vaccinate them when they're better. As a pharmacist When people would come in sick for an immunization, we would always tell them to wait until they felt better. Yet the hospital policy was to immunize severely sick patients, and it was against his judgment. He lost his job, and he is still having trouble finding another one. And I would just like to conclude that I spoke to the legislative budget officer about the fiscal note, and he confirmed that there is no appropriation in the bill. It's informational only, and the fiscal impact would be very minor and zero if no cases are filed. And thank you. I'll take any questions.
Representative DeLamus.
Thank you, Mr. Chair. Thank you for taking my question. So basically what you're saying is lack of knowledge destroys the people. And I'm wondering, do you have any idea how many people perished because of this lack of knowledge?
Thank you for the question. I would say the opponents of this bill will argue that it's a threat for doctors to be talking outside of the medical consensus. And I will admit there may be doctors that we'll just say are not good doctors. But the lives that we can save with free speech is exponentially more than maybe what a bad doctor might advise a patient. If you're asking me during COVID, I believe ivermectin could have saved many, many lives. The doctor who submitted his testimony also believes that. I kept waiting for the studies. Year after year after year after year. And everybody would say, the medical consensus would say, well, there's no studies. So it's no good because there's no studies. And anecdotally, and many of the doctors on this panel would say anecdotally it doesn't count, ivermectin was showing promise saving lives. And still, we don't have the studies.
Other questions? Representative Nagel.
Thank you, Mr. Chairman. Thank you for taking my question. I really loved your presentation because it really strikes home to me in a lot of ways. But the reason why I'm struggling with this bill is I've spent my entire healthcare career living outside the box, trying to find, innovative strategies to help people that are suffering from complex problems. And to be honest, nobody's ever given me any challenges, any difficulty telling me that I can't do that. And I understand you're presenting a specific incidents, but I mean, I've invented braces, used drugs for novel uses, things like that, and nobody's ever challenged me, questioned me, whatever. I mean, so I'm curious, why is this bill necessary?
So thank you for the question. Thank you for telling me that my presentation touched you in any way. I ran for office as a state representative because I wanted to make sure that what happened during COVID never happens again. As far as you not being targeted or it never being a problem, perhaps it was because it wasn't affecting the money pipeline to Big Pharma.
Representative Lamontagne, and then Representative Markell.
Thank you, Mr. Chair, and thank you for taking my question. One of the examples that you raised was thalidomide, and that was definitely a disaster. But it was stopped in the U.S. It was not used in the U.S. for the treating pregnant women because some people felt the research on its safety was not done. And we're really thankful, right, that we didn't have this happen in the United States. So that's an example where not prescribing it because the safety research hadn't done what was the right thing to do. And I feel that what your bill might do is say to some doctors, well, if you really believe it's safe, even though we don't have the evidence yet, you can go ahead and do it, even though the medical practice, the hospital is saying, no, we don't want you to do that. So it might actually open up, rather than bring forward solutions, it might actually allow people to prescribe dangerous drugs when it's used off label. So I have concerns that it may end up making things worse, not better.
I do understand what you're saying. Thank you for the question. And no matter what legislation is passed in this House, there's always unintended consequences, and we don't know what they're going to be. We're hoping when we pass legislation that it's positive. Can there be unintended consequences? It is possible with any legislation. And I just wish overall that whether it's federal legislation or state legislation, we always did look at that and reassess laws, which we never seem to do. But yes, I do understand your question, and it is possible.
Representative Markell and then Representative Nagel.
Thank you, Mr. Chairman, and thank you for taking my question. Earlier, you had mentioned federal regulations on point, which I think, if I correctly understood it, said that it would prohibit the kind of communications that you're suggesting be allowed in this bill. This is a two-parter. Can you pinpoint the regulations and where they would be found that prohibit the thing that you're trying to remedy with this bill? And B, do you know if they actually would preempt this legislation? By preemption, I mean that it would occupy that entire field of law, rendering your bill essentially nugatory, which means that it wouldn't have any meaningful effect.
Thank you for your question. I think that for the experience that I'm referring to, a lot of it wasn't regulations, but medical boards. And your questions are excellent, and I would love your help actually researching that.
Follow-up question, sir? Thank you. You also mentioned a doctor who lost his job with the hospital because he failed to follow, would it be fair to say, hospital procedure in terms of giving people vaccinations? Would that be a fair characterization?
I believe that, yes, that was what they expected their doctors to do.
Okay, so wouldn't that be more in the way of an employer-employee dispute by failing to follow policy rather than something that would have been remedied by this bill?
I can check with him and see what his thoughts are on that. I don't know what that looks like working for the hospital. But that's the kind, this bill is, that's the kind of situation that we want to address, is that you're able to use your medical opinion on what's best for your patient without being disciplined or fired.
Okay, thank you. No further questions.
Yeah.
Representative Nagel and then Representative Weber.
Thank you, Mr. Chairman. Thanks again for taking my question. I have a question if you would be amenable to an amendment on this, and it has to do with page 2, lines 21 through 25 on informed consent. ethically, when a doctor or healthcare provider prescribes anything that's an off-label use, what they're supposed to do is get an informed consent that includes the statement that this drug is being used for an off-label purpose.
Mm-hmm.
But it goes farther than that. Not only are you supposed to do that, but you're supposed to collect data on outcomes so that you can contribute to scientific knowledge. And I'll give you a specific example that you as a pharmacist would be aware of. It's like gabapentin was used, is probably the most prescribed, one of the most prescribed drugs for pain, yet it's not an analgesic. There's very little outcome data to suggest it has any value for anything other than neuropathic pain, but everybody gets it because it's not an opioid. And at this point, nobody's collecting data on that, and it's not FDA approved for pain, but people are still using it, and I think it would have been a responsible thing for doctors to tell patients those things. And I'm just curious if you would be amenable to putting those ethical guidelines into that part of informed consent.
That doctors collect the data and that there be
That they state very specifically this is an off-label use and why that they're choosing to use it.
absolutely. I would accept your help drafting that.
Representative Weber.
Thank you. I'd like to go in a different direction, and my question to you is about exploring the boundaries and edges of where one individual's right of conscience is allowed to impose itself on other people's actions. So my question is, if one person has a conscientious objection to a thing, why should the remedy be to impose their conscientious objection and the enforcement of it on everybody else, as opposed to what I would consider one's personal responsibility to follow one's conscience by finding a different job?
Do you have a specific example you could give me?
Not off the top of my head, but I think in these conditions, it seems to me that the tension is between, say, a nursing home, which cares for very, very vulnerable patients. And let us say that it's a private nursing home and they have a policy that says all of our staff must be vaccinated for the safety of our patients. Why does one individual's choice not to be vaccinated get elevated to a higher point than the facility's decision that the best interests of the people they serve and the wants and needs of the people they serve is different from the one person's right of conscience? That would be my example.
So I thought maybe that was your example. That's where you were going with that. I would argue that that argument is different than what this bill is. The argument for the doctor who was fired going against hospital policy may be a better example, I think, of what you're saying is why shouldn't he just go get another job? Which that may be a valid point. Hopefully Rep. Markle can help me with that.
Okay.
But what I would say to that is there were doctors that didn't work for hospitals, but the Board of Medicine targeted them because of what they were prescribing. So two kind of different scenarios there. So yeah, I want to protect the doctors from retaliation if possible.
Okay, thank you.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So in line with what Rep. Markell had said about, presumption. So one in section, it's on page 2, where it's referencing 332-0 protections of medical free speech. There is a section in section A here where it does have provide the communication is made in good faith and knowingly false and misleading, or whatever that section there. I think you need to look at, because reference to the FDA compliance, because there is a serious issue there with basically saying that the doctor can go above what the FDA has already regulated and how their language. I would look at the FDA language and match that if you would do that. And then also that brings up another question, follow up to that, is that in that section of the free speech, the boards, I don't think there's clear enough language to what the boards can do based on that federal language. So I think you would have to look at that as a legal perspective, just in my experience. So again, not really questions, but just insight.
Thank you for that.
Okay, Representative Lucas.
Thank you, Mr. Chair. Thank you for taking my question. I really appreciate your references to what's happened in the past with the thalidomide example, and also about how things have changed over the years with regard to estrogen therapy and the paradox between what was thought to be beneficial for reducing cardiac risk and what ultimately was shown to be true over a long period of time, 30 years or more. Mm-hmm. The Women's Health Initiative did show that actually, paradoxically, if the estrogen was prescribed more than 5 years after menopause, the cardiac risk went up. So where I'm coming down, I think, on this is the relationship between the healthcare provider and the patient. I believe that that's already protected speech. And what I'm concerned about, and I don't know that you can really answer this question, is if we try to legislate this interaction between the provider and the patient, will it actually open the provider up to a risk of litigation that we can't foresee right now, but that this attempt to legislate that interaction might actually increase the risk of the inadvertently of the exact opposite happening in the future?
So obviously nobody can know that. What I would say is the physicians here know how much litigation they're already up against because of how high their insurance costs are to protect themselves from litigation. And the way they protect themselves is informed consent. And so that's, I mean, you all know that. So as long as there's informed consent, there should not be increased litigation, in my opinion.
Follow up.
So why do we need this bill?
Again, this happened, and I want to make sure it never happens again. Doctors were losing their license to practice medicine. They were losing their jobs, their incomes to support their family. It was unconscionable. That was the red pill for me. That's when I started going down the rabbit hole of this whole mandates and why these things were happening. Like, why would a doctor lose their license for prescribing off-label? It's all about money. It's all about power. It can't ever happen again.
Thank you.
Representative Polazov.
Thank you, Mr. Chair, and thank you for your presentation. I like what you try to attempt, but it seems like you cover many different scenarios in line with Representative Weber and Representative Lucas were asking. specifically on page 2, lines 9 and 10, where you list all kind of different disciplinary actions, and some of it between provider and their employers, some of it with license boards, some of it with governmental agencies, and also, like, I think one of the central point of your bill is good faith, and then you list investigation as disciplinary action, and I understand that investigation can be like a punishment, process could be a punishment, but at the same time, maybe facilities sometimes need to look into something. I don't know if it would be called investigation, but if they do they need to ensure that provider acts in good faith and that they do have some basis to use the treatment that they choose to use?
I'm not sure if I understand the whole question, but I would say that if you're going to a provider, I would hope that you know that they're acting in good faith. Like you trust your provider.
Follow. So I think we are in a situation when there's conflicting opinions on which side is acting in good faith, and maybe both sides acting in good faith, they just have different opinions, or maybe as suggested, there's some other interests involved, but still it's a discussion about, as we heard in our testimonies, sometimes like there are different lists of research papers, different lists of like why certain research paper should be discarded. So I guess my question is specifically about line 9, like if some investigations if they are always should be viewed as just unfair punishment, or it's in some cases some kind of investigation is allowed, and like does somebody need to establish good faith, or is it more like, so it looks like there are several stages. So one is like negotiating between, like, for example, provider and the board. And then, and this bill says like, yeah, good faith provision, freedom of speech. But then second stage, if that didn't work, it will go to court. And then in court, hopefully it will be looked deeper, like that provider did act in good faith and was faced disciplinary action unfairly. Sorry, it was a long question, but maybe if you specifically focus on investigation on line 9.
So my hope is that there's never an investigation. You have doctors who present both sides to a patient and decide on a treatment. And it's informed consent. I do really like what Rep. Nagel talked about, because as far as prescribing off-label, I did not know that that they collected data. And that is how science is supposed to work. So if you have half of the doctors or half the patients say, well, you know what, I want to try this treatment, and the other half of the patients say, I want to try this treatment, the doctor's going to know pretty quickly. like what treatment works. And then when you pull all that information together, the best treatment rises to the top. So I will look at that more, the reporting, but again, I'm hoping that it's not needed, that people just accept that doctors are the ones that get to present the information to the patient and decide together what treatments to provide.
Representative Markell.
Thank you, Mr. Chairman, and thank you again for taking my question. In reading your bill, I'm looking at enforcement and remedies. This is on page 2. It's section 1. And to quote from it, it says, "A healthcare provider aggrieved under this chapter may bring a civil action for injunctive relief, reinstatement, damages, or other appropriate remedies." Now, does this apply to confer automatic standing to any healthcare provider who may not have been damaged in any way, shape, or form?
Can you tell me what that means?
Sure. In other words, as a general matter, when you're filing a claim for damages or a lawsuit, what happens is that your harm has to be in some way individuated. According to what you've read here, what's written here, a healthcare provider aggrieved under this chapter may bring a civil action for injunctive relief, reinstatement. So in other words, if I'm aggrieved by something that happens to a third party, and I'm not been damaged in any way, shape, or form, I can bring, according to this, I have automatic standing to be able to bring a damage claim for something that never happened to me.
So OLS helped me write this bill.
Okay.
I'm not aware of that implication.
Okay.
So again, if you can help me, if it needs to be amended, that would be awesome.
Be happy to do that, sure. Okay, thank you. No further questions.
Thank you.
Any final questions? Seeing none. Thank you. We do need a pink card, though.
Yes.
I forgot mine, too, so.
Yes, you did.
I know. Also signed up to speak is Kathy Stratton from the New Hampshire Medical Society. Representative Nagel, at least she was here on time to present the bill. We're going to talk about, at least she was here to present the bill on time. Good morning.
Good morning. Thank you for taking my testimony today. For the record, my name is Kathy Stratton. I'm the CEO of the New Hampshire Medical Society, and I'm here to speak on behalf of our members in opposition to this bill. While we feel strongly in freedom of speech and in rights of conscience for physicians, we believe this bill goes a little bit too far in the regulation of the practice of medicine, and fear that this takes responsibility away from the Board of Licensure to appropriately oversee and regulate the profession. That's their job. Their peer review committee. They are there to represent and protect the public. Practicing medicine is a privilege, not a right, and in that way, as they review different actions that come before them, it's their responsibility to look through what is in the best interest of patients, in the best practice of medicine, and to act and protect the public in that way. We believe this responsibility correctly lies with the licensing board, whether that's the Board of Medicine or the Board of Nursing, and we ask you to see this bill as inexpedient to legislate HB 1117. Thank you.
Thank you. Any questions? Representative Drew.
Thank you, Mr. Chair. The Medical Licensure Board is there to protect patients, but could they also not harm patients by preventing doctors from prescribing things that may help them?
Thank you for your question. I'm pondering it. They don't actually practice medicine, so they are considering what is considered best practice, scientifically based, proven medicine. And as Representative Nagel pointed out, they don't often get into the weeds of prescribing. And in this instance, as we heard from the sponsor of the bill, you know, that was probably a complicated issue, which they had the authority and the insight. I mean, we're sitting on the side. We don't know what went on. We don't know how that, you know, what the hearings were like and the process was like. You know, but I think having a bill like this that strips their authority and their ability to regulate the profession, I think that would be inappropriate.
All set? Other questions? Representative Polazov.
Thank you, Mr. Chair, and thank you for taking my question. So if we leave things as they are, and it's a job of the board to provide best advice, what mechanisms currently exist for corrective actions should the board start issuing like wrong decisions?
They're appointed by the governor. Board members are, so it's you know, it's a representative of peers that regulate the profession. So the Board of Nursing has their own representatives that are appointed. You know, I think that it's an agency that New Hampshire has chosen as a mechanism to review professional rights and responsibilities, and I think allowing them to do their job is what we're here advocating for. Thank you.
Representative Nabel.
Thank you, Mr. Chair. Thanks for taking my question. This is going to be kind of difficult, I suppose, but this issue is kind of personal for me. I mean, about 30 years ago, I had encephalopathic Lyme disease, which is a long story. I don't need to get into it. My primary symptom is that nothing Dr. Woods said for 6 months made any sense to me, but eventually they did. The doctor that I treated with, who basically, as far as I'm concerned, saved my career, was heavily into antibiotic use for Lyme disease, maybe excessively, I don't know, but it clearly was against the establishment's way of looking at it. He was eventually cited by the Board of Medicine, this is in New York State, not here, but and then basically brought for criminal prosecution for basically saving thousands of people's lives. And that's why I think this bill in some way, shape, or form has value to protect doctors' rights to do what they think is right for patients and not be subject to undue prosecution, punishment, whatever, by boards like that. And I'm just curious what your thoughts may be about that.
I mean, like I said early on, the rights of conscience of physicians, I mean, I think that's paramount. I think that the bill is problematic. You know, there is a due process that you go through with the board. I mean, you can have your attorney, you go through a hearing. I mean, there's a whole process of resolving a complaint. I'll put it that way. And is it a perfect system? Probably not. But there are peers and appointed physicians that serve to ensure that whenever possible, you know, patient rights, physician rights, patient care is upheld in the state.
Other questions? Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So again, I don't want to put words in your mouth, but I want to get the answer where it's at. So it sounds like the board itself on the extra limitations on the bottom of this bill with being able to sue, going after that, is where the conflict is with the board, or is it in the top language specifically, like changing the rules? Which would you say?
Oh, you know, I don't have the bill in front of me. I'm so sorry. I didn't break it down by portion. So I'm not sure I can answer your question.
Can I reframe that question?
But I can get back to you, sure.
Reframe it. Do you think that the injunctive relief part of it is problematic for the board?
I think it will be. Yeah. Oh, do I think can you rephrase that? I just want to make sure I understood your question.
So in here it talks about pursuing how they can pursue this. So it doesn't define, in my perspective, the way that the board would handle that. So the question is, do you think that would be problematic for lawsuits happening when the board doesn't have rules, let's say, in place for it?
I think let me get back to you on that. I want to take a deeper dive and really understand the substance of it. I was only really prepared to speak to the authority of the board and not undermining that and the importance of their responsibilities in this.
Well,
so then, to be clear, would you like it if this does move to pass, to make it more clear the language that the board would have to adapt, or what they would have to do?
From my perspective, there are rights of conscience for physicians. There is free speech that's already in law or in practice. So I don't see a reason for the bill at all. I don't. I mean, if you remove that, then all you've got is a declaration of rights of conscience and free speech. And I think that's incredibly important.
okay. Seeing no other questions. Okay, thank you. Also signed up to speak is Aubrey Friedman.
Mr. Chairman, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. I have written testimony, just a few points, but I'm going to change it a little bit just to concentrate on one point, having heard the discussion beforehand. The big issue I see is lack of trust by the public in doctors and hospitals. I mean, as we know it's been eroding over the years anyway. It used to be a special thing. You really trusted your doctor. It was a special relationship between you and your doctor, and kind of sacred. And over the years, it's changed. And clearly, in the COVID debacle, it was a disaster. And the statistics say it was 71.5% of the public in 2020 said they trusted doctors and hospitals. And now in 2024, it's 40.1, which seems to make sense. I don't trust, nothing personal against any doctors here, but I only go once a year. I don't really trust doctors anymore, to be honest, because of what not what they're doing, but I don't think they can really be a doctor anymore. You're constrained by the rules and everything, and there's plenty of things. There's new treatments, alternative ways, procedures could be done, and they really can't talk about them that much or they'll get in trouble. And I know my experience, I'm in good health and all that, but when it came to the vaccine, and of course that my doctor said, you're going to get it, or, he was pretty good about it. And I said, well, my mind was already made up. I wasn't going to get it, but I said, well, what about the long-term health effects? And he said, well, we don't really know about that. I said, okay, then obviously I'm not going to do it. But why would you recommend something that you don't really know what the long-term health effects are? And I'm not, as I say, he never bothered me after that. Saw him several more times over the years. So that was good. But it was his job to at least mention it. But really, if you don't know what the long-term health effects are, why are you recommending this? So I don't lose respect for him for that, because I know he's got to do it as part of his job, but I don't trust doctors anymore. So I think we need to try to restore the trust, that sacred relationship that used to be, and this is one of the ways in this bill, is to let doctors, let them be a doctor anymore and speak what they know. And again, it has to be informed consent, and without worrying about losing the whole thing is the license, because eventually you will lose your license if you go against these boards. So that's the real thing. So that's my main point, is I support the bill because it allows doctors to be doctors and provide their knowledge and discuss it with their patients, and that they can discuss it, and of course the pros and cons if they should try something different. So those are the reasons I support the bill. Thank you.
Thank you. You taking questions?
Yes.
Any questions? Representative Nagel.
Thank you, Mr. Chair. Thanks for taking my question. I'm sorry to ask you this, but for a lot of what you said, amen. I agree with a lot of what you said. As a doctor, really love what you said. We also practice in an absolutely awesome state relative to the United States. Our Board of Medicine's pretty reasonable. And I'm just curious if you have any data about doctors that are actually losing their licenses in this state for practicing their conscience.
No, I just heard about the terrible cases, you know, like in California and stuff, where you said anything or ivermectin or anything like that. Or also the vaccinate, you know, religious exemptions and stuff like that. That's I don't know how. I think we're pretty good here that way. But doctors should be able to speak what they know freely. That's what I think. Thank you.
Anyone else? Okay, thank you.
Thank you.
Also signed up to speak is Brian Grodman from Manchester.
Thank you very much. Just 2 minutes. The previous speaker mentioned that the New Hampshire Medical Board, she thought that this bill went a bit too far, but that board has never presented a bill relating to this subject previously. And the United States is the only country in the world that permits free speech. Not many people here don't realize that or understand how important that is, but it is the only country. And this bill does promote free speech. In our state, New Hampshire's state motto is live free or die, and the bill basically mirrors that motto. And I'm hearing people discuss the medical situation, and this is all medical, but would you want a legal advisor or a financial advisor not to have free speech? I owned a financial planning firm for about 40 years, and I'm retired now, but oftentimes financial advisors, and I worked a lot with attorneys, dozens and dozens of attorneys in the state, and attorneys and financial advisors have different opinions, and I don't think people would want to go to an advisor just whether it be legal or whether it be financial, who has a different opinion, and then that person gets shut down. I don't think that would behoove the client relationship. In the bill it says protection of medical free speech, and I think that's really of paramount importance. And I just wanted to say those things. I think it's extremely important. I don't see a negative to this bill. There may be some. Many of you know how to write a bill much more than I do, and you might want to change some of the language for different reasons. But the basic idea of the bill, I think, makes a heck of a lot of sense. Thank you.
Thank you. Any questions? Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. So here, like on radio, sometimes they put some how it's called. They say it's not a legal advice. Consult with your financial advisor. So does it mean that in that industry we also have some boards and some investigations? So if somebody is giving bad financial advice under the guise of being financial advisor, like it sounds like there might be some corrective actions. So like as this bill is fighting against disciplinary actions, like I wonder what are your thoughts like from that industry, what disciplinary actions should stay and what actions should go?
Thanks. I appreciate the question. So in the financial world, which I know fairly well,
if someone is
Point
licensed.
of order, Mr. Chairman.
Yes.
This bill is about medical issues. And are we not straying far from the medical issues when we start discussing what ought to happen in the financial industry? Is that an appropriate inquiry for this committee, given that we're already late?
Representative Plaza, do you want to clarify your reason for that question? Or?
If there is objection, we can discuss it. I can talk off level. Also, I think it's directly related.
No, that's fine. I'm just was wondering if just to clarify whether there's some concern. Yes, Representative. Well, you're not allowed to debate.
Oh,
sorry.
I'm Mr. Chair.
Sure.
I'm actually asking for a ruling on whether it's relevant or not, and that's for you to make.
Sure. No. But I was just wondering about the thought process and was wondering if there was a connection. That's all. That was my purpose in doing that. Representative Drew, did you have something pertinent to that?
I would argue that there is a connection. These are both fields that are highly regulated, and they have licensure that applies to them. So I would like to hear the comparison between the licensure and the punishments in the financial world versus the medical world.
Okay.
Thank you.
All right. Thank you. All right, sir. Can you answer that for us?
Absolutely. As I said, it will be a fairly quick answer. I owned a financial advisory firm. It was audited numerous times, and the way you get audited and the way this works is there's in New Hampshire there's a Bureau of Securities Regulation, first of all, and then in the federal level there's a Securities and Exchange Commission, and I've been audited by both. Was audited many times. That's just normal practice. When someone does something that is against the law, they are punished, whether it be a fine or, unfortunately, it could be worse, jail time if there's something that's done that's extremely poor for the client. However, if an advisor, whether it be a legal advisor or a financial advisor, makes a recommendation that is not possibly common. For example, most of us have wills or trusts or estates, and the person who writes it may write it in a different way than what's typical. Then there's no punishment. It's just a different way of doing it.
Okay. Thank you. Any other questions? I'm seeing none. Thank you.
Thank you.
No one else has signed up to testify on this bill. Does anyone else wish to testify on HB 1117 FN? Seeing no one, I'm going to close the public hearing on this bill and open the public hearing on HB 1449. And once again, welcome our Representative McGrath to the table as soon as the sign is changed. Thank you, Representative Hartnett.
Thank you, Mr. Chair, and thank you, committee. Again, I'm Representative Linda McGrath, Rockingham District 40, Hampton Seabrook. To introduce HB 1449. So in 2011, pharmacists in New Hampshire were authorized to administer vaccines. We underwent training, and we became a convenient and trusted source for immunizations. But never were we allowed to inject a child without a parent or guardian present in the immunization room. This was probably a corporate decision based on liability concerns, as every single product, prescription, over-the-counter medicine, or injectable has wide-ranging side effects. So Pfizer started finally publishing myocarditis as a side effect of the COVID shot over 3 years after its release. People would come in for the shot, and I would read the warning from the vaccine information sheet, which wasn't previously on it. Myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, have been seen rarely after COVID-19 vaccination. These risks have been observed most frequently in adolescent and young adult males. The chance of this occurring is low. And after reading the warning to the patient, I would ask the patient if they were still okay getting the shot with this new information. And they would often reply, "Oh, is this something new?" And I would reply, "No, they knew, they just didn't tell you before." When a judge forced Pfizer to release hundreds of thousands of documents that they wanted to hide for 75 years, we learned that they knew about the myocarditis before the shot was even approved for emergency use. As the risk is greatest in teenage boys, and myocarditis is not mild and can cause lifelong damage, this bill is to protect every single child from accidental harm. Some children have medical exemptions due to prior adverse effects of vaccines like anaphylactic reaction or Guillain-Barré syndrome. I called around to various chain pharmacies and asked them if I could send my teenager in for a flu shot with a signed consent form, and was told no. So this bill was introduced previously because there were 2 children who were vaccinated in a public school clinic, even though the parental notification indicated that the child should not be vaccinated, and no one was held liable. So what if these children did develop heart damage or died from a severe reaction? Where would the help for that family come from? So the original bill that I submitted had 2 parts. One was to prohibit vaccine clinics during school hours, and the other part was to have a parent or guardian present. So my plan is to submit an amendment removing the prohibition of holding the clinic during school hours, because leaving just the second section, having the parent present, would accomplish the goal of making sure that children aren't accidentally injected with no accountability. So the biggest criticism of this bill is that parents are busy and school clinics are convenient. But are parents too busy to protect their child? There are few, if any, areas that we sacrifice individual rights to convenience. So I ask you to support this bill as to have parents present during any immunization at a school clinic, as would be the case at any pharmacy, and I believe the doctors here would be able to confirm that would be the case at the doctor's office also. So if a school does host a vaccine clinic, the parents who want to be vaccinated can be vaccinated at the same time, since they'll be present with their child. So that would be convenient. So please support this bill, and I'll take any questions.
Thank you. Any questions? Representative Drew.
Thank you, Mr. Chair. As a
Pharmacist?
Pharmacist, thank
Yes.
you. I don't know why I'm thinking pharmacologist. As a pharmacist, are there any other drugs, prescription drugs, that you are permitted to give to a minor without parental consent, without the parents being present?
We do not administer drugs to children except for vaccinations. We fill a prescription, the parent takes it home and administers it.
Other questions? Representative Nagel.
Thank you, Mr. Chair. Thanks for taking my question. This is more out of curiosity because, like us older people, remember we got all our vaccinations in school. How common are school clinics for vaccination now? Because there's so many other ways to get a vaccination these days.
I don't know how common they are now. They were very common during COVID. And you're right. There are so many convenient ways to get a vaccination. You walk into any pharmacy and they're so happy to give vaccines because as a pharmacist, we're pushed because of monetary incentives to vaccinate. Ask every single person, do you need this vaccine? Do you need that vaccine? Who can we vaccinate? Bring them on down.
Representative Weber.
So am I incorrect when I thought that pharmacies did not administer children's vaccines, that those happened either in doctor's offices or clinics, and that pharmacies administer adult vaccines? Am I wrong about that?
No, we do administer children's vaccines. Different pharmacies have different rules, either 8 years old and up or 6 years old and up. But yes, we do administer to children. Yeah.
Other questions? Representative Lamontagne.
Thank you, Mr. Chair. Thank you for taking my question. So parents give consent for their child to be vaccinated at the school, correct?
Yes, they would send in a form. Unfortunately, there were instances of children, the form said, do not vaccinate, who received vaccination. So this is an extra protection for children.
But and I agree that shouldn't happen, but to then ban a program that many parents might want for the convenience and have consented to their child being vaccinated, that would be a negative consequence if they want their child to be vaccinated so they don't have to take another day off of work to schedule an appointment or take them to a pharmacy. Isn't that
Pharmacies are open till 9 o'clock at night. It's very convenient. I think that's been addressed in my testimony.
Representative Palazzo.
Thank you, Mr. Chair. So, if in my district 2/4 of students fail in science and the proficiency in science, should we take more time during school hours from teaching science and perform some medical procedures instead?
I absolutely think with the falling school test scores that we should not take any time away from basic education.
Anyone else? Representative Tejas.
Thank you, Mr. Chair, and thank you for taking my question. So what you described sounds like a quality assurance thing. Can you tell more about that? The cases you said that there have been of because right now vaccination requires parental consent, so that is already being given. And the added burden of having to be there in person is going to be huge. Tell us more about the actual evidence, like describe number of cases where it's happened, how it was managed, and what might be ways that we could actually do that as a quality assurance fix to the problem, which is what it is.
I don't know of any pharmacy that's accidentally vaccinated a child. There's 2 that happened in New Hampshire in schools, and my quality assurance is having a parent present.
Yeah, so can you tell us about those 2 cases and where that information is available?
I can get you that information. I don't have it here with me.
Other questions? Okay, thank you. Oh, I'm sorry. You're too close. I didn't see you.
Thank you, Mr. Chairman. Thank you for taking my question. So let's just say a child is accidentally vaccinated in the school rather than at a pharmacy, and that child has a very adverse reaction and dies. Wouldn't that one death be worth stopping the vaccinations at school and making sure people take their children to facilities where they are present?
I believe that it would, and I also believe that a multi-million-dollar lawsuit against the school district would be prevented, perhaps.
Thank you. Thank you.
Okay, I think that was the last question. Okay, thank you.
Thank you.
Also signed up to speak is Sarah Schlief from Dartmouth Health. How did I do on that last name?
You're close. It's Schlief.
Okay,
You want-
Schlief, I think.
Good morning, Mr. Chairman and committee members.
You asked for 5 minutes. If you could keep it to 3, that'd be better.
I will, yes.
Thank you.
For the record, my name is Sarah Schlief, and I'm a population health coordinator at Dartmouth Hitchcock Medical Center. Thank you for the opportunity to present this testimony in opposition to House Bill 1449. House Bill 1449 would harm New Hampshire children and their families by eliminating programs that offered low-barrier flu vaccination opportunities. Vaccination clinics during the school day greatly reduce the time that a student spends out of class and prevents a parent or guardian from missing work for a pediatric provider appointment. The school setting has proven to be a safe and supportive environment for children who may fear the doctor's office or vaccination. In the fall of 2025, I worked as the project lead and clinic manager of the school-based flu clinic program in the Greater Sullivan County Public Health region of New Hampshire, which includes the catchment areas of several Dartmouth Health System members. From October 1st to November 17th, 570 students in the region received no-cost flu vaccines from the school-based flu clinic program. Similar programs to this exist in other regions of New Hampshire and have been happening in New Hampshire for over a decade. 27 out of the 33 schools in the region opted to have a clinic for their students. School-based flu clinics are strictly opt-in programs. All parents and guardians are provided with an information packet containing the date of the school-based clinic, an influenza vaccine information statement from the CDC, and a consent form that they can return to the school nurse if they would like their child to receive a flu vaccine. If they would not like their child to receive a flu vaccine, there will be no documentation, there will be no consent form that will be passed on to the providers. School administrators continually send reminders to families with a date of the clinic to provide parents and guardians with ample opportunities to withdraw their consent before the clinic if they so chose. School clinic spaces prioritize privacy for the students and a group observation area for students to wait the required 15 minutes under medical supervision after receiving their vaccine. The student's identity and the completion of their consent form is verified by 3 staff members before a student is considered eligible for vaccination. Vaccinators were actively licensed paramedics, LPNs, RNs, or MDs who operated under comprehensive medical direction that was specifically drafted for the school-based clinic program. Students registered for the clinic were removed from class in small groups to avoid queue time and were observed by licensed medical professionals for 15 minutes after receiving their vaccine before returning to class. Students spent an absolute maximum of 30 minutes out of class to receive their flu vaccine. After seeing over 500 students receive their flu vaccine in a school setting, it's clear that being in a familiar environment, having the support of their friends, and having fun activities to enjoy afterwards greatly reduces the fear that children feel about receiving a vaccine. Parents and school staff alike have continually expressed their support for the school-based clinic program through end-of-season program evaluations. In Sullivan County and many other regions of New Hampshire, access to pediatric providers is incredibly limited.
You could start wrapping up, please.
Yes. Students would miss several hours of class to get a flu vaccine with their primary care provider, and parents or guardians would miss work for this appointment. I'd like to emphasize that these programs are strictly opt-in for both schools and families to participate in and minimally disruptive to the school days. Parents and guardians are welcome to attend the clinic if they so choose, but out of the almost 600 students I had attend the clinics, only 3 parents elected to show up, even though every parent is offered the opportunity to come to the school while their child gets their vaccine. Thank you for your time, and I will take questions.
Okay, thank you. Representative Drew. Oh, I'm sorry, Representative Mazer.
Thank you, Mr. Chair. Thank you for taking my question. So you mentioned that the school administrators send out the forms, packets, etc. This is new for me, information to me. How much time does school administration spend on doing this kind of thing?
So typically the school nurse takes the lead. I have the entire packet compiled. It's a digital packet, and they have the option to submit printed versions also. So it has to be distributed to the parents, whether that be at an open house night, emailed to the parents, put in the newsletter. It's up to the school how they would like to publicize this or how much time they would like to spend publicizing this.
Quick follow-up.
Follow-up?
Would you believe that I think that it might be more important for school administration to spend their time on academics versus overseeing health situations?
You can believe that, but this is an opt-in program of 33 schools in the region. 27 of them opted in to spend the time doing this.
Representative Joe.
Thank you, Mr. Chair. So you work for Dartmouth Health, correct?
Yes.
So I can assume that you're relatively familiar with their policies, correct?
Yes.
Is there any treatment where a child could walk into a Dartmouth Health facility with a signed consent form from their parent or guardian and get treatment from a doctor there?
Not currently. We're looking into doing that in the future. So this program specifically that I'm speaking of is coordinated by the New Hampshire Immunization Program, and Dartmouth participates in it. So we have match funding that Dartmouth puts into hosting these programs, but the medical direction is provided by the New Hampshire Department of Health and Human Services and the New Hampshire Immunization Program.
Follow-up?
So just to be clear, if a child came into one of the Dartmouth Health facilities looking for a flu vaccine and they had a signed consent form from their parent or guardian, would you give it to them?
I'm not a provider with Dartmouth Health, and I will not speak to that.
Okay, thank you.
Representative Kofal.
Thank you, and thank you for taking my question. So, 2 years ago, we had testimony on a similar bill in which Dr. Chan, the state epidemiologist, referred to an incident in which a 7-year-old was vaccinated in Nashua without parental consent, no form, no signature on the form, referred to that as a, quote, never event, something that should absolutely, positively never happen, except that it also did happen, again, in Rochester. How can you, so how does that square with this assertion that these school-based clinics are opt-in programs where parents have an opportunity to decide? And I will add that I have seen the consent form for one of those cases, and it was not signed. It was covered with big capital letters saying, no, 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 my child will not be vaccinated. So how do you square that with this assertion that these are opt-in programs?
I am not familiar with the case. I'm relatively new to the role in less than a year, but in the clinic program that I ran in 2025, every consent form was verified by 3 people. It was verified by the school nurse, it was verified by the staff check-in, and by the vaccinator themselves. So all 3 people would have to have missed that for the student to have been vaccinated. And that, I mean, obviously it did happen. I'm not going to argue that, but in the processes that I have run with my clinics, I don't believe that would have happened because we are verifying things very completely and very thoroughly.
Representative Kesselman, did you have your hand up? And then Representative Weber. Oh, okay.
Thank you, Mr. Chair. So again, you might not be the right person to ask this, but the question that Representative Mazur had mentioned, the school obviously is getting reimbursed for having their administrators do it, I'm guessing with some type of grant. In your experience, does the school themselves manage most of what happens on site at the facility, or is it the medical professionals that do it?
The school does not necessarily manage what happens on site. They dedicate a space for me, and I have all of the equipment. I have all of my team members. I show up in the space, and I set everything up. The most managerial portion that the school takes on, the nurse will take the students from class and bring them to me, because obviously I don't know where the students are in the building. So that is essentially the only role that the school staff plays on the day of the clinic.
Other questions? Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. So you've mentioned CDC statement being delivered to parents. So could you share example of it with the committee and also speak to what exactly is included? For example, does it say that flu vaccine basically it could miss the coming flu strain, or does it list all side effects from vaccine inserts? So what exactly in CDC statement?
Yes, so the CDC has vaccine information statements for all vaccines that are given. This year we used the Flucelvax flu vaccine, so we had the Flucelvax vaccination statement. It had the risks of the vaccine, what type of vaccine it was, and it had numerous ways to contact the CDC or report an adverse reaction to the vaccine if the person receiving the vaccine had some type of reaction after the fact. So it essentially goes over what is in the vaccine, what contraindications for the vaccines are, and what side effects may come from the vaccine. This is provided to all of the parents and anyone who receives a vaccine.
Other questions? Representative Delamus.
Thank you, Mr. Chair, and thank you for taking my question. So, admittedly, as you just stated, that mistakes are made and children are being vaccinated incorrectly or by mistake. Even Dr. Chan has said that. Wouldn't it be better if we could just eliminate any mistakes at all and any danger to any child regarding being vaccinated by stopping having them vaccinated in the schools and sending them with their parents to their doctors or to a pharmacy that is open until 9 o'clock?
I think in any healthcare setting, the goal is to absolutely eliminate mistakes, but that is not the case in any healthcare situation. Parents are welcome to come while their child is being vaccinated. We encourage that, we offer that, but out of the almost 600 students we vaccinated this year, only 3 parents chose to attend with their child. Parents also can choose to go with their child to a pharmacy, to their pediatric provider, but instead they're choosing to have their children vaccinated at the school without them being present.
Thank you.
Anyone else? Okay, thank you.
Thank you. I have written testimony, which
That'd be great. You just made the clerk very happy.
Tell the clerk before you speak.
They also signed up to speak as Elsa Winslow from Lebanon.
Hello. To the honorable members of the House Committee on Health, Human Services, and Elderly Affairs, my name is Elsa Winslow. I am a resident of Lebanon, and I am here to urge you to oppose Bill 1449. I am a medical student in New Hampshire, and I hope to be a pediatrician one day. Through my experience in clinic and community, I have come to see what most parents in New Hampshire already know. The most important thing we can do to keep our children safe is to vaccinate them. We must continue making vaccines accessible and convenient, and this includes allowing vaccines in schools. Today, parents have to sign a permission slip, and their children will receive the vaccine when vaccine clinics are offered in school. This bill requires parents to be present for their children to be vaccinated. This is not a change that would give more decision-making power to parents. It only creates roadblocks to them having their children vaccinated. This would require parents to take time off work and would likely end school vaccination clinics and the convenience provided to families. Every 6 months, my classmates and I travel to dairy farms in New Hampshire and provide health services to farm workers there, including vaccines. Our farm workers can rarely afford a day off, and bringing vaccines to the farms makes getting flu shots annually easy and convenient. Why would we make it more difficult for the children of the most hardworking members of our community to be vaccinated by requiring them to show up at schools to oversee a vaccine? These are the families whose health will be impacted by this bill. The barriers proposed are not only unnecessary, but they're inequitable. Schools are an amazing way to bring resources to families that may not get them otherwise, and even for families that would, but have other things on their plates. We should be taking advantage of the convenience of these clinics, not creating hoops to jump through. I believe that all children have the right to healthcare access, and while parents have the right to make decisions for their children, they also deserve to be supported in caring for their children's health. Putting another errand on their to-do list is helping no one. I want to be a pediatrician because it inspires me to see how much parents care about their children's health, and I want to support that. School vaccines are safe, equitable, and an innovative way to get all children health care. There is no reason to pass a bill that simply acts as a roadblock for families accessing health care for their children. Please vote in opposition of House Bill 1449. Thank you for your time and consideration.
Thank you.
And I will take questions.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. So, I agree with you that majority of parents want their children vaccinated, but we also have a significant amount of kids who are unvaccinated, both in New Hampshire and nationally. So, do you have any data that shows compares level of chronic diseases between population that was never vaccinated and population that vaccinated?
Yeah, I actually do. So I have a study about asthma rates and specifically the RSV vaccine. It has been hard to determine exactly, you know, how vaccines have affected chronic health, but they do. I did find this article that showed that since starting the RSV vaccines widely for children, that's actually decreased asthma rates. Asthma is maybe the most prevalent chronic disease among children, and it can be very devastating to children and families. So it definitely has, there is evidence to show that vaccination rates will decrease chronic disease levels in children.
Representative Mazur.
Thank you, Mr. Chair. Thank you for taking my question. Sounds like a lot of vaccines that you're visiting farms and all of that and distributing. Who's profiting off of all those vaccinations?
I don't know about the actual money. I do know that the way vaccines work in New Hampshire is a company buys bulk vaccines and distributes them to entities, which allows smaller institutions to buy them at lower costs. I don't have exact details about who is making money from these things, but I do know that this company is attempting to just generally make vaccines available and is not trying to make money off of that.
You said this company. Who is that company?
I have, yeah, I know my friend in the back knows. It's, yeah. Yeah, sorry, not a company. My mistake. I misspoke.
Representative Lucas.
A couple of would you believe.
Okay.
The first is the New Hampshire Vaccine Association coordinates the funding, which comes actually from insurance companies, and they make those vaccines available at reduced cost to providers who would not otherwise be able to afford to purchase those vaccines. And the other, would you believe, and you may have encountered this already in your infectious disease rotation, that the incidence of myocarditis in COVID survivors is 7 to 10 times higher than the incidence of myocarditis in individuals who've been vaccinated.
Yes, I would believe both of those. Thank you.
Other questions? Representative Drew.
Thank you, Mr. Chair. So I'm going to ask you the same question I asked the other woman who testified. I assume that you're far enough along in your studies that you are actually participating in the provision of medical services. Is that correct?
I'm a second year medical student, so while I have done some clinical work, I don't have a license, or I'm not practicing. No.
That's fine. Follow.
Follow.
So in your clinical work, is there any treatment that you would give to a minor if they showed up at your door with a signed consent form from their parent or guardian? In other words, would that provide the consent that is necessary for that minor to retrieve treatment in the clinical setting?
Yeah, again, I'm not a provider, so I don't know the exact legal things that you are able to give minors and not. I know there is a lot of rules about what you're able to give minors with or without their parents' consent, but these clinics through schools are very well regulated. It's not just willy-nilly kids showing up with random permission slips. This is an organized program, and parents are very informed and aware.
Other questions? Okay. Seeing none. Thank you.
Thank you.
Also signed up to speak is Aubrey Friedman.
Mr. Chairman, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. First of all, schools should be schools. Should not be a medical center or a hospital. Their kids are only there for like 6 hours a day, and when they have a vaccine day, this is a big distraction from the academics. That's the first thing. Second of all, parents are responsible for the well-being of their kids, not the schools, and it is the parents' responsibility to take care of these needs. If they need to be immunized or what, it's up to them. I was a single parent for many years, and they did not do it at the schools. You went to the doctor, you made the appointment, and this business with the convenience thing, to me, is a very poor argument, because you would make the appointment for late in the day so the kid is not missing any school at all because it's after hours, and you make the appointment late in the day when you miss very little work, and it's not like you have to go every week or every month. It's like a once a year thing. How much of a burden of this is on parents? I mean, if you have kids, it is your responsibility to take care of the needs. And if you have to go to the doctors once a year with your kid and listen to them scream when they get the shot, I experienced that. That's just part of being a parent. So we are discouraging parents from from performing their responsibilities as a parent. And this excuse about convenience, to me, is kind of disgusting. I mean, you're a parent. School is school, and was also mentioned, the pharmacies. Really, I just think it's not good. So we should not encourage parents to shirk their responsibilities. And actually, this would be like dropping your a young kid off at a doctor's office to get their shots, and I'll come back later to get them. Is this acceptable? Is this modeling good parenting? So those are the reasons I support the bill. Thank you.
Thank you. Any questions? Seeing no question. Thank you. Also signed up to speak is Anne Marie Banfield.
Good morning. Anne Marie Banfield. For the record, I'm a parental rights advocate, New Hampshire researcher, and I focus on academic excellence. So you're familiar with two children who were vaccinated against their parental wishes, one in Rochester and one in Nashua. According to district information at the time, all 8 districts' elementary schools and Rochester Middle School hosted clinics with 534 students. Nursing students from the University of New Hampshire volunteered to administer the vaccines, and the Stafford County Public Health Network worked with the state of New Hampshire to secure vaccine doses. Despite these layers of coordination, errors occurred. In at least 2 instances, children were vaccinated even though their families had clearly indicated they did not consent. I support this bill, by the way. This reflects a breakdown in process. Permission slips were not properly verified, and children were not accurately matched with consent records before receiving medical treatment. So I don't know where these layers were, but they weren't here. Vaccination is a medical procedure. Under long-standing legal and ethical principles, it requires informed parental consent when administering to minors. When the safeguard fails, even unintentionally, it undermines trust between families, schools, and public health partners. There are other ways to vaccinate children. So I support this after hours, absolutely. I'm not anti-vaccine. If you want your child vaccinated, bravo. Take your child. Do your parental responsibility. It does take time away from learning. 30 minutes? It takes 30 minutes away? Let me tell you, talk to a teacher. I'm in the House Education Committee all the time, and teachers are constantly complaining about all the time that is taken away from learning. And how are they supposed to be accountable to these proficiencies when you continually take students away from learning? the bills this year that the education committee are turning down because it takes away from learning. A student going to serve on the State Board of Education, that was before the House Education Committee recently. Once a month, a student's going to miss school. These are the things that you're adding on. So 30 minutes is a big chunk of time. This erodes trust when there are mistakes made. I know about these mistakes. So when my son was young and was offered a dental exam at school, yes, a dental exam, I kept him home for the day because I didn't want mistakes happening. And all of these parents, so you're going to do dental exams next? I mean, where does it stop? At what point are we going back to teaching how to read and write? Have you looked at the proficiency scores in this state and you wonder why we struggle with that? This takes a lot of time away from learning. And to say that this is just one, if this was just once a year out of the entire year, that might be a good argument.
If you could start wrapping up, please.
Okay, when you add this to all the other things, it does take time away. Parents should be there. Parents should be there if they have any questions at the last minute. Please vote to pass.
Thank you. Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So again, the department might be actually a better person to answer this question, but I figured since you're an advocate, maybe you could help me understand this. So I do see, looking at different things, that there's a lot of grant programs for vaccines. I wanted to know, in your experience, have you ever seen any of these grants, of this money going directly to the schools for these programs, or do you have any information on that?
Oh, I've seen many grants going to schools. The SAMHSA grant that came into New Hampshire was the mental health grant. And then from that grant came other grants like Project Aware. They came into the schools. That was for mental health. That was for basically mental health in the schools. We had a case in Seabrook, where the grant came into the school. Once the school board realized what the grant actually did, they then went and voted it out, because a lot of times the school board members aren't reading these grants. They're not looking at these grants. I have gone through grant applications, and what you give up to get the money, you're selling your local control. So to this specifically, it was the Keedy Medical Group that administered the vaccines, where the two children were vaccinated against their parents, and they immediately stopped that vaccine clinic. This was a few years ago, because of these mistakes. Again, you'll have to talk to HHS. I believe it was Governor Sununu's association with the Keedy Group that came, that's why that they were chosen to administer the vaccines. I could be wrong about that, but at that time, if I recall, he had some kind of relationship or something along that line. But in terms of the grants, there's a breakdown. There's a lot of times the school board isn't aware what's even in those grants. Parents aren't aware what's in those grants. I think there's some legislation in the House Education Committee in terms of making sure that these grants are being read, that people understand. Let's face it, this is profitable. This is going to make a lot of money for somebody. But I think that we need to look at how we best administer medicine to students and to children. I'm not against vaccines. My kids were vaccinated. But I got to tell you, there's no way my kid's getting any medical treatment, anything in a school without me being there because of these things. And I don't think parents understand that these things happen.
Yeah,
Most people don't know that this has happened to kids in our schools.
Thank you. Representative Kofal.
Thank you, Mr. Chair, and thank you for taking my question. So we are focused on New Hampshire here, obviously, but in your experience, have you seen other instances, because I understand these are not necessarily isolated. Are you aware of other similar instances in other states where things like this have happened?
Well, yes. Back in the 90s, Stroudsburg, Pennsylvania, they gathered up 6th grade girls and they took them down to the office. Now, parents were not aware. They did not consent, and they gave him gynecological exams. They were screaming, they were crying. You can find this. This is easily, I was doing this research back in the night, so I recall this. And they sued, and the parents won. But that's how far some of this thought process about we don't need to have parents there, we don't need to have parents present when we're administering medical care to students. We know better than parents. These 6th grade girls could be, sexually active at that age. We need to do an exam on them. And this was done by a physician. This was in Stroudsburg, Pennsylvania. There's other cases in Massachusetts. They put a what do you call that?
Intravenous?
No, for birth control in a girl. In Maine, at the school-based health clinic, one of the girls came home and put some medication on the counter, and her father saw it and said, "What is this?" And it was I didn't want to say Zoloft, but I could be wrong about that. Comes to find out, they had prescribed medication to his daughter for mental health purposes. By the way, this medication does create suicidal thoughts, and so he went to the school, and the school was like, "Hands off! This is a federal grant money coming in. We don't need parental consent, and this is the feds doing this. This isn't us." And he took his daughter out of the school and had the Children's Services come and visit him. And he was, obviously exonerated because he was actually looking out for his daughter. But I'm not going to waste your time. I could go through many, many cases, but yes, there's many cases of things, accidents. We didn't know that this was going to happen.
Representative Drew, did you have your hand up?
I did, but
All set? Okay. Anyone else? Seeing no one else. Okay, thank you.
Thank you.
No one else has signed up to testify on this bill. Does anyone else wish to testify? If not, I'm going to close the public hearing on HB 1449. Our next hearing is scheduled for 1 p.m. 1797 FN will be heard at that time. In the meantime, we will be in recess. Okay, good afternoon, everyone. Welcome back. The next bill to be heard today, the only bill left on the schedule, is HB 1797 FN. And I'll recognize the prime sponsor, Representative Jim Kofalt.
Thank you, Mr. Chairman. Thank you, members of the committee, for hearing my testimony. For the record, my name is Jim Kofalt. I represent Hillsborough County District 32, comprising the towns of Wilton, Temple, and New Ipswich. I'm here today to present House Bill 1797, which strengthens our food stamp program, also known as SNAP, in 3 important ways. Number 1, it protects our state budget because of changes in federal law that institute penalties on states that have high payment error rates in the SNAP program. Number 2, it ensures that benefits go to those who are truly needy, preserving program integrity. And number 3, it ensures that SNAP is helping families to buy real nutritious food, not junk food and things that are detrimental to health. So beginning in 2028, states with high payment error rates above 6% are going to have to kick in part of the cost of the SNAP program, so between 5 and 15%. So just to put it in perspective, New Hampshire's error rate is around 7.5%. We are pretty good compared to other states. So Alaska, for example, has a payment error rate of 24.66%. The District of Columbia is somewhere between 17 and 18%. But H.R. 1, also known as the One Big Beautiful Bill, stipulates that if states have payment error rates exceeding 6%, those states are going to be on the hook for between 5 and 15% of those benefits. So that is potentially a very high cost to states that don't get their act together very, very quickly. So just a slight increase in the error rate, the penalties can double. So error rates, by the way, consist of both overpayments and underpayments. So if you overpay somebody by $2 and you underpay somebody by $1, you're not netting out those numbers. Your error rate is $3 of whatever the total is. So these error rates come from a number of different sources. Interestingly, about 73% of errors are something known as BBCE, broad-based categorical eligibility. There are several experts who are going to be talking after me, and they may want to address that BBC mechanism and how it contributes to very high error rates. So, as I said, beginning in 2028, New Hampshire is potentially on the hook for nearly $8 million annually, and the clock is ticking now. So we need to get our act together on reducing that error rate right away. So HB 1797 helps lower the error rate in a couple of key ways. For example, it closes a loophole that allows households to enroll with incomes and assets that exceed federal limits, and that is BBCE. The mechanism I described earlier is a critical loophole. This would close that. It requires routine cross-checks of the SNAP rolls against state and federal databases to look for eligibility changes as quickly as possible. And it would formally review eligibility of enrollees who have frequent changes in circumstances that affect eligibility. So these aren't, strictly speaking, just about error rates. They're about program integrity, making sure that we don't experience high rates of fraud. As I said, New Hampshire does pretty well on that as it is, but we want to make sure that we continue to have strong measures in place to maintain program integrity. The bill also prioritizes food stamps for truly needy granite staters by requiring legislative approval of broad-based waiver of work requirements for able-bodied adults. So we've addressed the question of work requirements in an amendment to a Medicaid related bill a month or two ago. The work requirements are primarily the same. There are some subtle differences in the work requirements between the SNAP program and the Medicaid program. Interestingly, 97% of I believe it's 97% of people who are on food stamps are also on Medicaid in the state of New Hampshire. But one of the things that this does is it says that the state would not be able to apply for waivers to the work requirements or broad-based waivers to those work requirements without going to the legislature and getting approval. So this is essentially saying legislative intent is that we will have work requirements. We will be adhering to the standard work requirements as specified by the federal government and outlined in H.R. 1. This bill also ensures that benefits go to the neediest granted staters by strengthening verification processes for citizenship and qualified alien status, and also referring illegal aliens applying for or receiving food stamps to the appropriate federal authorities. Finally, this bill brings the SNAP program back in line with its core purpose of helping low-income families to afford a nutritious diet by prohibiting the purchase of soda, the number one item bought with food stamp benefits, and candy. New Hampshire was recently ranked the healthiest state in the nation, and this provision helps to safeguard that achievement by ensuring that SNAP supports nutrition, not chronic disease. 18 other states have already implemented this measure, and although I have not seen our Rural Health Transformation Fund application, my understanding is that CMS has indicated that the governor has indicated support for this type of measure, which increases our funding eligibility under that program. 18 other states have already done this. This is not about limiting personal choice. There are a lot of things that we don't allow people to buy with food stamps, tobacco and liquor, for example. This simply adds some items that are not part of a nutritious, well-rounded diet necessarily. And obviously everyone on food stamps is free to use their own money. If they want to use their own money to buy soda and candy, they're welcome to do that. So with that, I thank you for your time. I urge your support for this bill, and I'm happy to take any questions.
Okay, thank you. Representative Weber.
Thank you. So you made reference to a different bill in which we made it clear that certain people who categorically cannot comply with work requirements get a pass on having to redo everything every month or every 3 months. Mm-hmm. And I was wondering if you could just email us where that exactly is in the legislative process. So has it passed, and what those requirements actually are at this stage in the progress through the legislative process?
The question is, where are we with the bill that we addressed previously? The SB, I forget the number.
You made reference to it, and
okay,
so
yes.
I'm asking you what it is.
Okay, I believe it was 231, and that passed the House. So I believe at that point it was to go back to the Senate for concurrence, and I don't know what the status of it is at this point.
Follow up.
But I will get that information.
Okay. If I may have a follow-up, yeah. What I'm driving at is because I made some comments about it and you told me I had it wrong in the context of a different bill. I want to be sure that I am clear as to who must do the verifications themselves. This has a lot of provisions about what DHHS is going to do to verify that don't require the recipient's participation. They're going to check with the lottery. They're going to do all those other things. And so my concern is figuring out exactly which participants must continue to verify their qualifications and on what schedule.
Thank you for the question. So I'm going to defer to one of the experts who's going to be testifying after me, who will probably fill in some of the details on that.
Thank you.
Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So yesterday, I believe, we heard 1773 on some of this issue. And I want to point out here in the nutrition services section where it's basically making it so that the commissioner shall adopt the rules under this. I would love to know your perspective because we heard testimony that that basically would be almost impossible or hard to do this without having proper language in that other bill to distinguish what soda, candy, snacks, all these things that would be prohibited would be. And I was just curious your information on that.
So I have to confess I have not watched the video from yesterday's hearings yet, so I did not hear those arguments. Having said that, I think if there were if the committee were interested in putting more specific language in there, I think we certainly could entertain adding that kind of language in an amendment.
Anyone else? Seeing no one else, thank you.
Thank you.
Also signed up to speak is Scott Centorino. Do I have the last name right? Yes, sir. Okay, I'm getting good at this.
That would help, wouldn't it? Good afternoon, Mr. Chairman, members of the committee. I'm Scott Centorino. I'm here on behalf of FGA Action. Relevant here also is that I served from January of 2025 to last month as a Special Assistant to the President for Domestic Policy in the White House, where I helped coordinate the administration's welfare policy. And obviously the biggest thing to happen in that area over the course of that year was the aforementioned One Big Beautiful Bill. And I will, by the way, be submitting, I'm happy to submit a written testimony as well. The reason I'm here to urge you all to support this bill is the way I see it from where I sit. There's sort of a DC way to implement this bill, and there's a New Hampshire way. And this bill strikes me as the New Hampshire way. As I was preparing for this, I had a random memory that I hadn't thought about in a long time. The first bank account I ever opened was at the Lancaster National Bank up in Coos County. And I went in there, I'd earned like $15 from playing trombone in the town band in the summer. And I remember getting the blue booklet. Those are gone, of course. The name of the bank is gone. The whole experience has totally changed. But the values of the people that I saw in that bank, just in the lobby, where people were depositing their paychecks and withdrawing money, are the same now as I think they ever were in New Hampshire. People were absolutely proud of their hard work that had earned them those paychecks and that were providing for their families. People were absolutely frugal with their money. People were absolutely committed to helping their neighbors. And people in this state, as you all know, absolutely hardcore believers in the power of common sense. And if New Hampshire does not act and pass bills like this, I'm afraid that it will be stuck with the DC way, and that's not reflected in those values. So as Representative Cobalt mentioned, part of that bill, One Big Beautiful Bill, is it will start sharing with the state accountability for the error rate. And if nothing changes, that means $8 million out of the state budget. If just a few clicks go up in that error rate to 8% from a little over 7 now, it's going to be $16 million. And of course, with no change, that means less money for roads, schools, all sorts of things, or higher taxes, of course. This bill, on the other hand, I think is the New Hampshire way because it, as Representative Cobalt mentioned, it promises full implementation of the work requirement in food stamps. It protects the program for the truly needy, and it closes that loophole he mentioned, the broad-based categorical eligibility loophole, which I think is the biggest barrier between where New Hampshire is now and full and safe implementation of this bill without federal penalties. Right now, and I'm happy to answer questions about this because I know it's complex, right now there is no asset test for food stamps in New Hampshire. You can be a millionaire, you can have $1 million in your bank account, and you qualify for food stamps in New Hampshire. It's almost unbelievable, right? But it's true. And I'm happy to wrap up there. Look forward to your questions. I urge your support. Thank you very much.
Okay, thank you. Representative Weber.
Thank you, Mr. Chairman. Thank you very much for being here and taking my question. I wrote down that you said you represent FGA Action. Is that correct? And if so, what does FGA stand for?
Yes, ma'am. When you only have 3 minutes, you try to keep it tight, right? So FGA stands for Foundation for Government Accountability. It's an organization that has been working on welfare policy for over 10 years now, and these issues are our bread and butter.
Follow up.
And are you based here in New Hampshire or are you based elsewhere?
I'm not. I live in Virginia now.
Other questions? Representative Mazur.
Thank you, Mr. Chair. Thank you for taking my question. So what is the primary purpose of SNAP? And then I have a follow-up after that.
Representative, it's a great question. It's often overlooked in technical debates like this. The primary purpose of SNAP is to provide nutritious diet to people who would otherwise be hungry. That was the original intent. I mean, if you go way back, it was about connecting people to agriculture that was overproduced during the Great Depression. You'd literally give boxes of food to people who were out of work and hungry and needy. The program has evolved in a number of ways, obviously, but I think the intent is still there. It certainly was when those laws were passed in D.C., and I'd imagine the intent is still true in New Hampshire, that's the intent of this program, is to make sure that people aren't going hungry and hopefully provide them with nutritious food. And my colleague Tim Puglisi will testify after me, and he will speak a little bit more about the junk food provision in this bill. But in general, I mean, nutrition is in the name of the program. It's about giving nutritious food to people.
Thank you. Follow-up?
Sure.
So does this bill move us further away from that purpose or towards it?
Representative, I think it absolutely moves New Hampshire's program closer to that original purpose. The purpose was certainly not to become an income supplement for folks deep into the middle class, which it has become in a lot of ways. It's only meant to serve the truly needy, and it's meant to be an efficient program that works well for that population, particularly, if I may, for households that cannot work and cannot support themselves, either with poor children, households with members who are disabled, the seniors who are obviously low income. Those folks need help, and that's what the program is designed to do. And if it doesn't get back on a sustainable track, if it goes beyond that original intent, I'm afraid that obviously that those people who have nowhere else to go for support will be worse off for it.
Representative Markell and then Representative Lamonte.
Thank you, Mr. Chairman, and thank you for taking my question, sir. We heard testimony from Representative Kofalt that approximately 18 states have implemented this program. Can you help us with what has been the result and what has been the public reaction to that approach?
Representative, it's a great question. I will defer to my colleague Tim Puglisi on the junk food prohibition, if that's what you're discussing. If you're talking about broad-based categorical eligibility, a number of states have taken that approach too, and it's lower administrative costs.
Okay.
But I think you're referring to the junk food.
That's
provision.
correct.
Yeah.
Representative Lamonte and then Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. How many millionaires do you think would subject themselves to applying for food stamps for a benefit of about $5 per person a day?
Well, Representative, I'd answer that question with at least a few, because we know them. One of them has worked with us before to highlight the problem. Rob Understander, he was from Minnesota. He was a millionaire and discovered this loophole and enrolled for the purpose of showing that it existed. We don't know the true number because there's no asset check. And so we don't know is the short answer to your question, and that seems like a problem that we don't know the answer to that question. How many folks are above the asset limit in food stamps in New Hampshire or any other state? I don't know. Nobody does.
Representative Palazzo.
Thank you, Mr. Chair. Thank you for taking my question. So, in your testimony, you mentioned New Hampshire way and DC way. And if we do nothing, then it will be DC way. So, what exactly will happen if we do nothing? Is DC way means some funds will be withdrawn from New Hampshire? What will happen?
Yeah, Representative, it's a great question. So the way it works is if your error rate is above 6%, New Hampshire's is a little over 7 now, New Hampshire will be on the hook for about 5% of your administrative costs. If it goes 8% or higher, that doubles to 10% of the administrative costs. And then it escalates beyond that. And so right now, if nothing changes, it'll be about $8 million that New Hampshire's on the hook for out of its general revenue. And if it goes up just a couple clicks, like I mentioned, to 8%, that'll jump to 10% of the administrative funds, which is about $16 million. And of course, it's up to you all how you find that money, and not me. Of course, that's how, as you all know, DC so often imposes rules on you and you have to live with them, right? It's up to you all, not me, how you find that money. But if I were in your seat, I'd rather sort of solve the problem with common sense and make sure the people who are on the program are actually eligible for it. That way, you have a better program, a stronger program that serves the truly needy better, and you don't have to pull the money from somewhere else.
Representative Drew.
Thank you, Mr. Chair. Okay, so you just talked about verification. It's a little mind-boggling to me that the SNAP program doesn't have verification at all. I was not aware of that. So how do you go about this? Talk about the section of the bill that goes through the verification and how much that's going to cost and where that's going to leave us.
Representative, it's a great question. So there are a number of provisions in the bill that are about verification, of course. Some of those are regular cross-checks with data sets the state and the federal government already have. It makes sense to just compare lists, make sure nobody's dead who's also receiving food stamps. You have some of that vital records data, for example. Another provision, obviously, is more frequent verification, more robust verification with federal immigration records to make sure that illegal immigrants who are not eligible under federal law are not receiving those benefits. The most robust verification piece is that broad-based categorical eligibility. So if it's all right with you, sir, I'll take a minute to explain it. In New Hampshire right now, the way it works is, and this is a little bit of a simplification, of course, but I'm happy to give you more details. If I apply for food stamps, I can get a brochure, piece of paper, you name it. In other states, it's a hotline, but in New Hampshire, it's a brochure. That brochure, for technical reasons, is funded with your TANF cash welfare program. And I hand that to you, sir. And I say, okay, you have now received a TANF benefit because this piece of paper was funded with TANF dollars. And because you've now received a TANF benefit, you are a TANF beneficiary. And as a TANF beneficiary, you are not subject to the asset test in food stamps. Why, you might ask? It actually comes from a good place back in the day. The little bit of regulatory history that might be important here is before the Welfare Reform Bill in 1996 in D.C., it was much harder to get on TANF than on food stamps, right? TANF is a much more restricted program. And the idea was, well, if you're already on the TANF cash welfare program, you're certainly eligible for food stamps because it's a harder program to get on. And so for the reason of trying to eliminate administrative duplication, we're not going to go through the rigmarole of checking everything for this person if they're already on cash welfare, right? Makes sense. The problem is one of the unintended consequences of that 96 welfare reform bill is it made the TANF program much more flexible, which for the most part, a good thing, right? But it allowed states to call new things benefits. And so states over time realized, the state agencies, I should say, realized we can call almost anything a TANF benefit. And if we just give that to somebody, then they're a beneficiary and they're not subject to the asset test. And the reason this is so on point with the error rate, and this is the part that takes a little bit of a leap. I know this can be wonky, but it's not just that somebody has assets in the bank. We're talking liquid assets, just cash in the bank that put them over the asset limit. It's that if you're not even checking that, you won't catch other things. And so over 70% of the errors in New Hampshire are because of households that enroll only through that loophole, the broad-based categorical eligibility loophole. 70%, 80% of the total costs of your error rate are households in that category. The minority of the population that is enrolled just through that loophole causes the vast majority of errors in this state. The reason is not just that you're not checking their assets to see if they're eligible. If you check somebody's assets, you see all sorts of other things. Like you might discover, oh, somebody has a joint bank account with somebody else that is a live-in boyfriend or girlfriend or whatever and has income that they're not putting on the form. They're saying they live alone. Oh, but they have a joint bank account right here. What about that income? They didn't put that on the form. And so you find other things just through the verification process, just in that asset check. It's not just about the asset check itself. It's about what else you find in that verification process. So that's essentially what it does in the states that don't have this loophole. That's what they do. They just follow federal eligibility guidelines and they say, okay, if you're applying for food stamps, we're going to make sure, get this, you're eligible for food stamps, and actually do an asset check and you find other things.
Representative Weber.
Thank you. Thank you for taking another question. So what is the current asset limits and what kind of assets are counted and what kind of assets are not counted?
Representative, is a great question. Again, another thing that's often lost in these questions and these hearings. So the asset limits specifically, they're different if you have a member of the household who is disabled or elderly. It's $3,000 if you do not have a member, or excuse me, if you do have a member of the household that is disabled or senior, and $4,500 for other households, which seems very low. But bear in mind the answer to the second part of your question, it will explain that. The only thing that is counted in that asset check is, again, simplification, but liquid assets and essentially luxury items. So money in the bank, and if you have a second property or a boat or something that is really not what we would consider sort of an essential item, that is counted. What is not counted is a long list of things, and I'm happy to give you the full list. It is your primary residence, household goods, your vehicle, if you have any, obviously, retirement accounts, pensions, college accounts for your kids. I mean, you could have significant assets and still qualify with that asset check. Their burial plots, I mean, you name it, something that you consider, well, that we probably shouldn't hold that against somebody. It's not counted in that asset check. We're talking about money in the bank primarily.
And one more. So you stated 3,000 if there's a person with a disability in the household.
I misspoke. It would have been 4,500 for those households and 3,000 for the other categories.
I was going to ask
Excuse
you
me, yeah.
why you had less for the disability households and more for the others. So,
Well, I can't explain all federal law, ma'am. The Congress does what it does. But in that case, I misspoke. That's my responsibility.
Gotcha. Thank you very much.
Representative Palazzo.
Thank you, Mr. Chair. Another question, if you're comfortable asking it. So on page 3, on lines 7 and 16, so it talks about SAFE program, systemic alien verification for entitlements. So if you could, why is this program, and I guess is it? It looks like additional burden. So why is it justified?
Representative, it's a great question about SAFE verification. Why would you go through that? So of course, illegal aliens are not eligible for food stamps under federal law. The reason that's not the burden it once was, because I'll be honest, if I worked in a state agency in 2024 or any time before that, I actually think that's a legitimate concern because it was burdensome. And folks in this room may know this already if you've ever interacted with that SAVE system, which is how you basically ping if somebody is here legally or not. It's a federal website essentially. Before 2025, it was a horrible system. I'll be honest with you. I saw that version last year in my time in DC, and it was not user friendly. The state agency had to pay per ping, which obviously kind of defeats the purpose in a lot of ways for verification. You had to do it one by one, person by person, which is obviously extremely onerous. One of the things, and I've even found a lot of folks in state agencies don't know this yet, and so I'll share this good news with you here. One of the things that happened in 2025, and you don't have to agree with the intent behind this at all, but one of the things that happened in 2025 is that SAVE system was completely redone, and so it is now entirely free to state agencies. There's no cost associated with pinging against it. You can do bulk uploads, so you can actually just upload an entire Excel spreadsheet. I've seen it done, and they will give you almost automatic instant results on that entire list. And more than that, because they've incorporated the federal Social Security Administration's Death Master File, you can do more than just see if somebody's here legally. You can see if they're a citizen. And as you all probably know, in the One Big Beautiful Bill, there are certain rules now about there are certain non-citizens that are eligible, but there are also some categories of non-citizens that are not eligible for food stamps. And so the SAVE system can help you identify those populations immediately and for free now. And in my experience, the state agencies, a lot of them do not know that those changes were made. And so that should help relieve some of your concerns, sir.
Representative Kesselring and then Representative Drew.
Thank you, Mr. Chair, and thank you for taking my question. So I'm looking on page 2. You kind of outlined that other program. I just want to verify that the information there, the department will review. There's a lot of thing on a monthly basis here. So that system will do all of those things in that line, or is there things in there that it won't do that the department's going to need to do?
In which line? I'm sorry, sir.
Sorry, it's looking. It's the section on line 21.
On page
2.
21. So, Roman numeral 8.
Yes.
Is that right?
Yeah.
That's a different system, sir. So yeah, that's more of the answer about SAVE was about the line 17, Roman numeral 7. Oh, I'm sorry, that's not it. Where is it? What you're talking about starting in line 21 is just more robust verification with existing state and federal databases,
correct,
separate from the SAVE system.
Follow up. So with that, this stuff does look like it has overlap from what you just said. that SAVE system will verify some of that detail.
It could, Representative. It could, yeah, that could be part of the verification process.
So maybe there's clarification language in there for the department. Obviously, we have to hear from the department to see if that could stop some of the duplication.
I have no opposition to anything that stops duplication or makes this a stronger bill. Certainly. Whatever works for you all and your department, sir.
Representative Drew and then Representative Weber.
Thank you, Mr. Chair. So one of the most common forms of SNAP fraud is essentially getting an EBT card with SNAP funds on it and then selling the use of that EBT card to someone else. Does this help with that in any way?
Representative, it's a great question. Yes is the short answer, although probably in an indirect way. One of the things that sometimes I'll recommend to states that are particularly concerned about that is, say, photos on EBT cards. That way there's a little bit of a disincentive to using the card of someone else. This bill doesn't approach that. But if there's more regular verification against these systems, in theory, it should help with that, and especially the recertification piece, where a household with zero earned income is asked to verify their system. That's the kind of thing that would trigger reviews that should catch the households that are trafficking their EBT cards. Because you bring up a good point. Some of the folks in the room may not know this. Anybody that's worked in law enforcement knows this very well. It's incredibly common to find EBT SNAP cards in any kind of drug bust, essentially, because it's currency. It's black market currency. People sell it for less than the full value because it's liquid, right? And so it's a real problem that you're identifying. This bill should help. It's not the silver bullet for that problem, though.
Representative Weber.
So just to be sure I'm understanding, I thought that you at least implied that this SAVE program, the Systematic Alien Verification for Entitlements program, which is on line 7 of page 3, am I correct in thinking that doesn't have anything to do with all of the stuff on that system? Doesn't deal with any of the things on page 2, which are data for citizens as opposed to non-citizens?
Representative, the SAFE system is separate, is the short answer. It would be part of the verification process to ensure that somebody's either here legally or a citizen. But you'd have to check other databases for their additional information.
Right, but it doesn't cover things like any of the other things that are different that need to be checked on page 2. Because I thought you implied that the system would help with that.
Representative, it would, in that a household that is ineligible for reasons that you'd find through SAVE, you wouldn't have to cross-check them on the other systems,
Right.
obviously.
It's only a process of elimination, though.
That's right. That's
Okay,
right.
Thank you.
Yep.
Anyone else? Okay, thank you.
Thank you.
Also signed up to speak is Tim Puglisi. Put your microphone on. There you go.
Sorry about that. Thank you, Mr. Chairman and members of the committee. For the record, my name is Tim Puglisi with FGA Action here in support of House Bill 1797. So I want to begin with that stated purpose from the USDA for what SNAP is supposed to do. It's to supplement a family's grocery budget so they can afford nutritious, essential food to health and well-being. The question before you all is, does the program currently reflect that purpose? SNAP benefits already can't be used for fast food, alcohol, or tobacco in New Hampshire. No one argues that those limits violate freedom. They exist because SNAP is a government-run nutrition assistance program, and this bill follows that exact same logic by better aligning SNAP purchases with nutrition rather than personal preference. This matters because SNAP households roughly face twice the rate of diet-related chronic diseases, including diabetes and obesity. And to be clear, I'm not saying this is only caused by SNAP alone. It reflects income constraints, access issues, and the environment around them. But here's the concern. Soda is the #1 item purchased with SNAP benefits. If we know these issues face higher health risks, should a government nutrition program subsidize items like soda that exacerbate these conditions? New Hampshire's not breaking new ground with this idea of this soda and candy waiver. The state already essentially committed to pursuing one in its Rural Health Transformation Fund application. And at least 30 states have made similar commitments, including Vermont and Connecticut, when looking at those rural health transformation applications. 18 states already have approved waivers, and 5 are actively operating, with many more going into effect in the next couple of months. I also just want to address the concern that DHHS might have to spend hundreds of thousands of dollars to hire investigators to monitor compliance. Explicit FNS guidance makes it clear that they will monitor the compliance for these waivers, so the state doesn't need to create its own enforcement division. Additionally, retail tech firms in other states have found ways to ensure retailers can smoothly implement these changes, avoiding costly system changes while maintaining compliance. In closing, I think this bill is really practical and measured. It doesn't shame families or take food off the table or expand government control over what people can eat. It simply brings SNAP back in line with its purpose of helping families afford nutritious foods that support long-term health. With that, I thank you for your time, and I respectfully urge your support for this. I'm happy to answer any questions.
Representative Kesselring and then Representative Weber.
Thank you, Mr. Chair, and thank you for taking my question. So I asked the same question as to the main sponsor of the bill about the nutrition services and how it's outlined for soda and candy. We heard in another bill that it would be really hard to define something like Twix because it has flour in it. So with that, could you help me understand what other states have done in this process to implement?
Mr. Chairman, Representative, thank you. That's a great question because it's something that comes up in most states where these types of bills are heard. I think the way this bill approaches it is actually really smart and will avoid those problems where maybe a Twix isn't considered a candy while a Kit Kat is, or vice versa. It allows the department to define candy and soft drinks for their waiver. And you can take what's working in other states to avoid these pitfalls. I know, for example, Oklahoma, their definition of candy specifically targets items that are commonly advertised or marketed as candy. And states like Louisiana are making clear, direct carve-outs for items that are commonly marketed or advertised as granola bars or protein bars, to avoid some of the pitfalls that other states' definitions had made. And then when doing so, they're able to establish a clear list and follow these definitions. I'm happy to follow up with the committee and provide what every single state's approved definitions of candy and soft drinks are. They're publicly available on FNS's website, but they have found ways to make sure that you don't have the pitfalls of, oh, well, a Twix bar is not a candy, but a protein bar is. So again, really that marketing piece has alleviated some of those concerns in those states, and they've already are sharing with retailers a clear list of UPCs to get out of their POS systems so that they can maintain compliance and easily implement this.
Follow up.
So I guess the question would be, in your experience, is there any state that does it the best that we could look at specifically?
Mr. Chairman, Representative, on the candy component, I think that the definition that Oklahoma is using is really good, but there are definitely ways where you can, mix and match what's good from multiple states. I think both Oklahoma and Louisiana have the most robust definitions that I've seen. On soft drinks, most states are taking the approach of using what's called the streamlined sales tax definition of soft drinks. So many states that have sales tax, unlike you all in New Hampshire, they exempt typical groceries from the sales tax, but they include items like candy and soda in the sales tax collection. So there is a common definition of soft drinks used across state lines to ease compliance with different sales tax rules and laws for multi-state retailers. So that's another definition I'd be happy to follow up with the committee with. On that note, I did not mention this when I gave my testimony. I will be sharing my written testimony. I'm sorry to the clerk. I'm so sorry.
I don't apologize.
Representative Weber.
Thank you, and thank you for taking my question. I noted down something that I didn't quite understand, so I hope you will clarify for me. I said F&S will monitor so the state doesn't have to, and I need to be reminded what FNS is and what they're monitoring so the state doesn't have to.
Mr. Chairman,
Or
Representative.
did I just mishear?
No, you heard correctly. So FNS is Food and Nutrition Services. That's the
NS.
Sorry if I misspoke. That is the federal agency that administers the food stamp program.
Okay, got it.
In regards to what I was mentioning about compliance, the federal agency FNS is monitoring it. They've explicitly shared guidance with all of the states that have implemented these waivers, and it will be the same way in any state that does so, in that they will monitor compliance for that retailer compliance with these changes. And that's how things are done typically anyway. So when you hear about these secret shopper visits and whatnot, they are already happening for things that you can't buy with SNAP, like alcohol, hot prepared foods, tobacco, you name it. This would just be that FNS is now also checking for candy and soft drinks.
Thank you. I'm sorry I misheard. I heard the middle bit as an ampersand rather than an N. So, and then may I have a follow-up, please?
Sure.
So, who funds FGA Action?
Mr. Chairman, Representative, there isn't one single donor. We have donors from all across the country. To be honest with you, if you were to put me on a hot seat and I don't know a single donor's name for our organization. It's all mainly single individual donors. I think it's like less than 1% or something like, please don't quote me on this, but it's a very small fraction of the money that's received as corporate. It's all individual donations.
And as a follow-up, you said your colleague said you were based in Virginia. Is there a filing for is it a nonprofit? Is there a filing with? We have the charitable trust division that nonprofits have to file with. Is there somewhere you have to file that information?
Mr. Chairman, Representative, so the organization is based out of Florida, and we have employees across pretty much every state in the country. I live in Massachusetts, so I grew up actually on the border and live in now a little bit south of the border, but of the border of New Hampshire. So but across the country we have employees. So, and we're based technically out of Florida. Most people work remote for us.
So one last follow-up. So does your organization do the equivalent of our charitable trust division filing in Florida?
Mr. Chairman, Representative, I'm not sure on the state front. We have like the federal tax filing 990 forms. Those are publicly available online. I believe they're actually on our website. So again, I've never looked at it, but that's publicly available information that you can certainly obtain.
Thank you.
Representative Markell, and then Representative Lamont.
Thank you, Mr. Chairman, and thanks for taking my question. With the 18 states that we've previously discussed, can you tell me about the kinds of objections that they saw within these states prior to the adoption of these regulations and how they were overcome?
Mr. Chairman, Representative, so 18 states have adopted these waivers. The first went into effect on January 1st, and there is a 120-day grace period in working out the hiccups and the different changes in using their POS systems with the changes. There were a lot of the concerns that have been brought up. Probably, I know there was a similar bill heard yesterday, but there hasn't been this, the sky is falling, situation. In fact, these retailers have new products that come onto the shelf every single day. And there are multiple different classifications that retailers have to maintain. Namely the WIC program, which is a much more stringent program. I will say that is a more cut and dry list of what's available, what's eligible, and what's not. Mainly to supplement a a mother of an infant or a pregnant woman. But there are other very complex tax advantage accounts like HSAs and FSAs that are used at many of these retailers and that are coded into POS systems at even small retailers with very complex tax guidelines that are used by these retailers to say this item is FSA eligible and this item is HSA eligible. So there already was a framework to do this. There was a lot of concern because this is a new idea. It's a waiver. We're testing the effectiveness of such a new idea. But from what we've seen, retailers are still accepting are implementing these waivers, and they're putting up signage for customers, and they're helping spread word and educate about these changes in those states. So we'll learn more about the effects as time goes on.
Thank you.
Representative Lamontagne and then Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. Are you aware of, and I'm looking at USDA's own research on the subject, that while soda may be the single item most commonly purchased as a category, meat, poultry, and seafood is the accounts for the largest category of food purchased. And overall, the food choices made by people using their SNAP benefits is not that different from consumer choices by people not on SNAP. So do you think that we might actually spend a whole lot of money trying to make restrictions to change behavior that is not going to matter that much whether they use SNAP or not?
Mr. Chairman, Representative, thank you for your question. So I do want to make a quick clarification. So based off of USDA research, $20 billion a year is spent on soda, candy, salty snacks, prepared desserts, and I think it's about 11.4 billion is spent on fruits and vegetables. So I believe this is the same study that you're researching. There's different ways they group things, but that's adjusted for fiscal year 2024 spending, based off of that research. We basically took fiscal year 2024 spending based off of research on spending patterns. On the topic of SNAP recipients having similar consumption and spending patterns, there have actually been multiple research studies about SNAP recipients, even compared to those who are eligible for the program but not enrolled. And they found that SNAP enrollees typically have poorer diet quality than those even not enrolled in the program at similar income levels, and that they actually consume more soda. I'm not trying to demonize people on SNAP. What we're trying to say is there's reason to potentially prioritize healthier, nutritious products on these programs, and there are many factors that go into diet quality and maybe even consumption patterns. But when we talk about this program, it's a government nutrition assistance program, and with this bill, we're talking about only soda and candy, which there have been studies about that there's higher consumption for those enrolled in the program. And additionally, there has even been studies by the current NIH director during his time, not as NIH director, that restrictions of sugar-sweetened beverages would reduce chronic diseases such as diabetes and heart disease for hundreds of thousands of people. And I'm happy to share some of these studies with the committee. So.
Representative Palazzo and then Representative Lucas.
Thank you, Mr. Chair. Thank you for taking my question. So, two-part question about cost and potential health benefits that you just mentioned. So, our department gave us fiscal note indicating that, in their opinion, implementation of this idea will cost us hundreds of thousands of dollars every year, including cost to facilitate retail adoption and for certification and for implementation, and just building the waiver may cost north of $800,000. So I wonder if other states were able to build waiver for less than 800,000, and those benefits that we are trying to achieve here, less heart disease, less obesity, less diabetes, like do you have any idea like how much would we save with that, and how long should we wait before we see those results? Is it like 5 years? Is it decade? So what's the plan here?
Mr. Chairman, Representative, thank you for your question. First, answer that second part and say that 75% of SNAP enrollees in New Hampshire are on Medicaid, and that number jumps to over 95% for children. So when we're talking about restricting sodas and candies that are directly tied to chronic diseases, there are definitely long-term savings in promoting nutritious diets and preventing chronic diseases related to soda consumption. On the topic of how have states been able to avoid the costs in implementing such a waiver, I will note that multiple states, I believe Colorado, Indiana, and a few other states had listed in their waivers to FNS, and in some states where they passed bills where there were fiscal notes, that the administrative costs would be absorbed by their state departments in implementing these waivers. And states have found ways to avoid costs on the demonstration component. So this is a demonstration waiver. It's supposed to demonstrate, you're getting a waiver of federal law to demonstrate if something is effective in change of the overall outcome of the program to align with its purpose. And so states have partnered with both public and private universities to conduct those demonstrations and avoid the costs of those demonstrations. I will also note that the latest publicly available information for New Hampshire's EBT vendor, that EBT vendor is implementing these changes, similar waivers, I should say, in Missouri and Florida. So there's a framework there, even with the existing vendor for your EBT.
Representative Lucas and then Representative Mazur.
Thank you, Mr. Chair, and thanks for taking my question. Do you happen to know in the studies that you're referring to whether or not they looked at the availability of potable water in relation to the soda consumption?
Mr. Chairman, Representative, I may have misheard you. What type of water?
Potable, drinkable water.
Oh, yes. Mr. Chairman, Representative, off the top of my head, I do not remember. I think it was related to a diet quality measure called forgive me, I'm only remembering the acronym off the top of my head. It's the HEI.
Follow up?
Follow
up. Are you aware that bottled water is often more expensive than soda?
Mr. Chairman, Representative, I would say that bottled water is pretty comparable in price. I will say this. I looked at the average price of items at Walmart, and a 12-pack of Monster energy drinks is about $24.99. For the same price, I'll pull it up here just so I'm not giving you misinformation. For the same price as a 12-pack of Monster energy drink, you can get a half a gallon of milk, a dozen eggs, a loaf of whole wheat bread, a 2-pound bag of carrots, a 3-pound bag of apples, 3-pound bag of sweet potatoes, 1 pound of boneless chicken thighs, and a 1 pound package of pork chops, all for about the same price. So I do want to sympathize with the concern. There's a valid concern about nutritious habits, and that could be expensive. But when looking at the price of these items that we're seeking to prohibit, in the price of real whole foods, there's value. There's value there in purchasing these real whole foods.
Thank you.
Representative Mazer.
Yes, thank you, Mr. Chair. Thank you for taking my question. So I see the fiscal note and I see the numbers there, but I also heard that if we don't pass this, that we could be potentially on the hook for at least $8 million loss of federal funding. Did I hear that right?
Mr. Chairman, Representative. So the loss of federal funding that has been mentioned in this committee hearing is related to the payment error rate. So that's related to eligibility errors and intentional program violations and a couple other things. This, not implementing this, could impact the amount of money New Hampshire receives from the Rural Health Transformation Fund. New Hampshire actually received the most money in the region from the Rural Health Transformation Fund this year, partially because of the policy commitments and the investments that are being made in the state to strengthen rural health. However, one of the key components of these policy commitments that bring more money into the state is that if they are not implemented, CMS will reduce the amount of funding in future years or will claw back money it's given to not implement policies that were committed to in a state's Rural Health Transformation Fund application.
Representative Kesselring.
Thank you, Mr. Chair. Just a clarifying question for you. Because it says here that the 5% is what the federal standard is under HR 1. Could you, I mean, I don't know if you're the right person to ask this, but it looks like from what the department has given us that money starts when our error rate or problem rate goes above 5%.
Mr. Chairman, Representative, so the financial impacts for payment errors, that goes into effect once the payment error rate exceeds 6%. That's obviously increases the higher the error rate is.
Follow up.
So then to follow up, so if the department does the work to get it under 6%, we're in good shape and we're not going to have to worry about that, is what you're saying.
Mr. Chairman, Representative, certainly that is true. I will say that the policies in this bill, in particular, the policy to prohibit broad-based categorical eligibility, are proven ways to lower that error rate. And there are also ways that that policy in particular can also lower administrative costs per enrollee. And there is changing in the administrative funding structure in this program as well. That hasn't been mentioned quite a bit following the passage of the One Big Beautiful Bill, but administrative funding shares are also going to be changing, and more of that will fall on the state. And I will also mention that states that aren't using BBC, such as like Utah, Idaho, Wyoming, they're under that 6% threshold. So the proof's there that that policy in particular lowers the error rate.
Representative Mazer.
Thank you. Thank you for taking my second question. So will shoppers from other states stop coming here if we ban soda and candy from being purchased with food stamps?
Mr. Chairman, Representative, no. I reject that concern entirely because under federal law, SNAP purchases everywhere are not they're not subject to sales taxes. So like somebody from Vermont, Maine, or Massachusetts, like where I'm from, if they use their EBT card at Market Basket in Newburyport, they're not going to be subject to sales tax with that EBT card. The reason why people come to New Hampshire to shop isn't to use their SNAP card, including those on the program. They come to New Hampshire to buy items that aren't eligible for SNAP, like toilet paper, diapers, cleaning supplies. There's plenty of items that are not eligible with food stamps, on food stamps or the SNAP program. And people that are on these programs that are cross-state shoppers, they're going to New Hampshire to buy those items to dodge the state sales tax in the state that they're from.
Thank you.
Anyone else? Representative Drew.
Thank you, Mr. Chair. So it's my understanding that the retail systems, essentially the way this works at a very high level, is they have a database. That database has all their UPCs in it, and they have those UPCs categorized in various categories, as you noted. Some of them are WIC eligible, some of them are SNAP eligible, some of them are HSA eligible, some of them are FSA eligible. So it's also my understanding that this data changes on a fairly regular basis. Is that accurate?
Mr. Chairman, Representative, that is correct. If I may, I think it might lead to your follow-up. Maybe it's a concern that, well, items are coming on the shelves and coming off the shelves, and how a retailer is going to, adapt with things coming off and on the shelves. So I will say in particular, there is a retail tech company called Nielsen IQ. They're actually working with the National Grocers Association released a one-pager about the services that they're providing states, and they're providing subscription services on retailers can choose a one-time, a quarterly, or a monthly basis, and the costs are based off of the retailer's size. And those lists that Nielsen IQ is creating are specific to each state's definition of soda and candy, so that retailers can navigate the definitions in their state in particular and upload, the new items coming onto the shelves that are considered candy and soda on a month-to-month basis or a quarterly basis to maintain compliance.
Well,
thank you, Mr. Chair. So it would be fair to characterize any changes to this system, and basically adding candy and soda to these lists would be fairly trivial for the retailers to implement because they do this already all the time.
Mr. Chairman, Representative, there are many guidelines and classifications that retailers have to meet. We're talking about WIC, or if a retailer accepts FSA or HSA funds, certainly. So this is an added step. I mean, additionally, when you talk about SNAP alone, there are plenty of items that are coming on and off the shelves already that are not, allowed for purchase with SNAP. When we talk about, cleaning supplies, paper goods, the toiletries in the toiletry section of a grocery store. So,
Representative Kesselring.
Thank you, Mr. Chair. I want to give you a follow-up question because it sounds kind of contrary to what we heard in testimony yesterday, and I just want to clarify the language. It sounds to me like the department, through the SNAP program, through the card, would deny that purchase at, let's say, Massachusetts, if I was a New Hampshire resident. Is that the case, or is that not the case?
Mr. Chairman, Representative, so in federal law, the SNAP program, your EBT card and the way the state administers it, it has to be interoperable. So what that means is I'm from Massachusetts and I go to Seabrook and I go to Walmart in Seabrook and I use my SNAP card, right? My SNAP card will work just like somebody from New Hampshire even though I have a Massachusetts SNAP card. And let's say on the contrary, being from New Hampshire, you had a SNAP card and you came to Massachusetts, it would work the same way that my SNAP card from Massachusetts does in Massachusetts. Does that answer your question?
Follow-up, just to clarify. Just to clarify, that means that anything that we deem not approved in New Hampshire, if Massachusetts doesn't do it, if they come to New Hampshire, they can't purchase those items.
Mr. Chairman, Representative, yes, that is correct.
Okay, anyone else? Last call. Okay, thank you.
Thank you.
Also signed up to speak are Brian Clark and Karen Hebert from the Department of Health and Human Services. You've asked for 10 minutes. If you could keep it, I can give you 6. I can give you 6, 3 for each one of you, if that works.
6 each? That's perfect.
No, 3 each.
Yeah. Oh, 3 each. So, good afternoon. My name is Karen Hebert. I'm the Director for the Division of Economic Stability at DHHS.
And I'm Brian Clark, General Counsel for the Division of Economic Stability.
So I wanted to start first with the Healthy Choice Waiver. I spoke quite a bit about it yesterday, but there are some of you who are not here yesterday, so I'm happy to answer questions about that. But I do want to point out that the fiscal note for the Healthy Choice waiver specifically does assume that changes would be made to implement a waiver of food restrictions at the EBT processor level, as opposed to the retailer level. The current use is at the retailer level, but I do want to point out that there is no appropriation for this bill, and the department would not be able to implement anything at the EBT level without an appropriation. But speaking with that, there are a number of components to that. If we were to do something at the EBT level, which no states that we are aware of currently are, they are doing this at a retailer level. We would have to include the components of auditing and enforcing the provisions of the restrictions. So their costs associated with that are significant, that we've estimated about $1.4 million.
There were also some changes to able-bodied adults without dependent work requirements. So SNAP requires able-bodied adults without dependents, commonly referred to as ABODs, to work 80 hours per month to keep receiving SNAP benefits beyond an initial 3-month eligibility window. So this makes changes in 2 ways. One is we have authority to request waivers in areas of the state that have high unemployment. We don't currently do that, but this would restrict us from doing that without legislative approval. So if there were an economic downturn, we wouldn't be able to request a waiver of ABOD requirements without going to the legislature first. Next, it would eliminate the use of ABOD discretionary exemptions. The department doesn't regularly make use of discretionary exemptions, but generally what they're used for is to provide a short window to prevent errors in eligibility. For example, after the COVID pandemic, the ABOD work requirements were on hold for the SNAP program for a long period. And when they were being re-implemented, we used our discretionary exemption to provide everyone with another month just to give us time to get messaging out about what the requirement is and what it entails. Also, additionally, it's not clear to me what legislative approval means. It doesn't say whether that's approval of both houses of the legislature or approval of a particular committee. So it'd be great if that could be worked out. So the bill does eliminate expanded categorical eligibility. So what that would do is effectively lower the income limit of the SNAP program from 200% of the federal poverty guidelines, to 130% of the federal poverty guidelines. That change was made to expand benefits as part of the department's effort to address the benefit cliff. So reverting that could potentially make the benefit cliff worse. Additionally, it would require everyone to pass an asset check, which would mean that there's additional work on eligibility workers to verify resources, which could lead to errors because every time you touch something that you didn't touch before, it could lead to an error in the determination.
And I'll elaborate on that just a little bit with respect to the error rate, because we certainly making changes to basically do redeterminations more often than we're doing right now basically would require more work, a lot of manual work among the staff that do the eligibility for the department. That particular staff, we have been maintaining a 25 to 26% vacancy rate, and we have 70 out of 250 positions that are unfunded in that particular area. So the challenges already exist. So I just want to, I'm concerned about how that will impact the error rate going forward. And then the ripple effect of that impacts to the error rate. If our error rate increases, there are certainly ramifications to the state in that regard.
And just to provide numbers of people affected, we estimate about 6,774 SNAP households have income above 130% of the federal guidelines and less than 200%. So those households would likely lose eligibility so should this legislation be enacted. And of that household, it's 6,313 children and 8,885 adults.
Yeah, could you repeat those numbers, please?
Oh, okay. This is a snapshot from a few months ago, but 6,774 SNAP households, and that consists of 6,313 children and 8,885 adults.
If you could start wrapping up.
Yes, so I do want to address the data verifications in the bill just real quick. A lot of them are things that the department already does, and so there wouldn't be a huge impact on the department other than if the federal requirements change, having it enacted in state law could create a conflict that we would have to address in the future. There are a few that are of concern that we don't currently do, and there's no appropriation to build a data cross-match system for those. So the lottery cross-match, we don't currently have a lottery cross-match, and we don't have, there was no appropriation to build that system. The SAVE system, as it's written in the proposed legislation, it requires the department to verify monthly every citizen and non-citizen via SAVE. So the SNAP regulations only require verification of citizenship if questionable. So currently our process is if someone provides a birth certificate, we wouldn't, and we know that that's a birth certificate, we wouldn't question that, and we would treat them as a citizen. So doing that and then also requesting verification for SAVE would violate FNS rules. And then additionally, SAVE is a manual process where we get the data back and then an employee has to look at it. It's not a cross-match system where it would happen automatically, the review. And so it would be a lot of additional work. And typically, the qualified immigrants who are eligible for SNAP hold a immigration status that frequently does not change on a monthly basis.
Okay, thank you. Any questions? Representative Lucas and then Representative Palazzo.
I'm sorry. It's been a bit of a day, and I want to make sure I heard something correctly. Was it said that the error rate might actually go up if this becomes law?
Thank you for that question. There certainly is a risk to that because the concern that we have is essentially the volume of manual work that may be added to the staff that end up doing processing all of this work because of the resources and limitations that we have for eligibility staff. Things that are going to impact the error rate are of a concern for us, essentially because of the changes in the federal law under H.R. 1 that require states to, starting in fiscal year 28, states will have to contribute a percentage of the benefit of SNAP. SNAP has historically been 100% federally funded, but that has changed. And if there are error rates, I think it's been testified here, if our error rate increases, then we are looking at a state share, and that amount of the state share is going to be dependent on what our error rate is. If it exceeds 6%. There was testimony, and I can also testify, our error rate for fiscal year 24 for 25 has not been officially determined yet, but for 24 it was 7.57%. While that is down from the previous fiscal year, which was at 12.5, we're in the right direction. So our strategies are working. However, there's still concern that if we're above 6%, we're looking at paying a percentage of the benefit for folks in New Hampshire. So we're really watching and needing to monitor what is impacting our ability to process and eliminate or reduce errors as much as possible.
Follow-up.
Follow-up.
Thank you. So with the measures you're undertaking, is there a concerted effort to get the error rate down below that 6%?
Yes, thank you for that question. Yes, absolutely. So we have been have an entire team of our SNAP experts. Two of them are here with me today, who have been extensively analyzing the root cause of the errors that are occurring in New Hampshire. We've been meeting with other states, other partners to really take a look at what is it that's causing the errors in the first place. Largely, they are clerical mistakes that are made in calculations, for example, because some of the work is still manual. So there are efforts to look at staff and training, so people, processes, to try to streamline them or automate them, and then of course systems. The more the system can do for staff and eliminate some of those manual processes, we would be in much better shape. So we're looking at implementing and continuing to implement a lot of those strategies going forward. We received a $1.1 million grant from the federal government to look at implementing certain processes within the system that would improve our performance using a number of different strategies with technology so that we can try to address that as well.
Thank you.
You're welcome.
Representative Plaza.
Thank you, Mr. Chair, and thank you for taking my question. I actually have several, but let's start from changes at the EBT processor level. I believe you mentioned that other states made it on the level of merchandise, or whatever it's called, and this bill, I believe you said, will be more burdensome because it changes it on EBT processor level. So my question is, like, are we talking about page 3, line 22 and 24, where it says utilize ABT card data to flag? Do I understand correctly that your recommendation would be, if we are to go forward, to change at what level we do this verification?
So the department doesn't take a position on the bill, so we don't really have a recommendation in that regard. But the item on page 3, starting with line 24, is not really related to the healthy choice waiver directly. Do you want to speak to that?
Yeah. So when we had testified about making the verification at the EBT level, that vendor level, that was about implementing the healthy choice waiver and making sure the EBT vendor can assure that no soda or candy in New Hampshire is being purchased. The item on page 3 that you were referring to, that's about out-of-state use of EBT cards. So our current process is, well, we have to allow out-of-state use of EBT cards. So if a person goes to Massachusetts with their New Hampshire EBT card, they can use their SNAP benefits to buy groceries there. Currently, we look at data manually. If someone's, we look at if out-of-state use raises a question of residency. So if a person in Nashua frequently buys groceries in Massachusetts, we wouldn't consider that something that indicates residency to be questionable. However, if it was frequently buying groceries in Idaho, we would request verifications because we would assume residency in New Hampshire is questionable because of that, because of the 2 months. What this item on page 3 would do is it would require an automated system to be built where it would look at everyone's out-of-state use, and if it was exclusively out-of-state for 2 months, we would send a request for verification, regardless of whether it was a person in Nashua buying groceries in Massachusetts or someone buying groceries in Idaho for 2 months.
Follow up. Thank you, Mr. Chair. About FNS rules violation, could you clarify what the context was? Do I understand correctly that implementation of SAVE system and following determination can cause FNS rules violation, and if so, how does it happen?
So specifically, it's about citizenship. So the FNS rules say we need to verify citizenship if questionable, but if we verified it, if we've gotten a birth certificate, then it's not questionable. So making a request to save to verify someone's citizenship would be questionable, or would, excuse me, it would violate the rule that says only request verification if questionable.
All set. Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking my question. I think you answered Representative Lucas with a good bit of what I was concerned about, but I thought I heard you describe real concerns about staffing up for this project if it were to become law. I just wanted to give you a chance to speak a little more about that, what your concerns are.
Sure, thank you very much for the question. So I think there are a number of provisions in the bill that would require additional staffing that we have pointed out. I did provide some written testimony, and I hope that that is helpful for everyone because it describes some of those. But staffing with increased manual work for a lot of the verification requirements that are in this bill would be necessary. Certainly if we did a Healthy Choice waiver on an EBT processor level would also require additional staffing for enforcement of the restrictions as well as customer service. There is another provision. I'm trying to find that. One of them is with respect to the SAVE process that's done by the department at the time of application and redetermination. And if there's going to be a requirement to do more redeterminations greater than the 6 months we currently do, that will certainly increase the workload there. We are estimating needing about 5 additional specialists to meet those increased requirements from the proposed legislation.
Thanks, that's helpful. I'm just trying to get a realistic idea about, were this to become law, what we might actually expect to have happen on the ground. So thank you.
Yeah, and I'll just follow up with that. I mean, without that, then we are looking at risking an increased error rate.
Yeah, thank you.
Thank you.
Representative Drew.
Thank you, Mr. Chair. Citizenship when questionable. That's a really loose statement in my opinion. Can you give us any idea of the percentage of people who are receiving SNAP benefits in New Hampshire whose citizenship was questionable and checked, or whose citizenship was considered not questionable and was never checked?
So if we don't have a birth certificate or naturalization papers on record, and we don't receive that from somewhere else, we would consider it questionable and request that. So we always check if we didn't. So basically, if I had been receiving food stamps and I'd provided my birth certificate and the department had a record, Brian Clark was born in Indiana, and then I reapplied after having not received the SNAP, and if we still have that record that I was born a U.S. citizen, then we wouldn't consider myself questionable. But if we didn't have that, if I was applying and they'd never seen me before, that I would need to provide a birth certificate. So it's always checked.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. This might be a little bit more of an in-depth question because the SAVE system sounds like it imports and takes in a lot of the information. Just quickly searching based on other testimony, there's a lot of data points that you're already taking in the SAVE system would eliminate. So could you walk me through the legal side of how you could import the data on the other fields besides leaving out the immigration side of it and maybe help your process? Because one of the things here about the staff and the appropriation and all that is systematizing this, right? And it sounds like the SAVE system would help you systematize some of the need and some of the things.
So currently, we're required to check against the SSA database for if someone's receiving an SSA benefit. It's not currently constructed in a way that we could use SAVE.
Follow up on that?
Follow up.
Could you elaborate on why?
It's because of the federal FNS regulations to require us to have certain data cross matches. So we're required to have a cross match with the SSA system directly. And basically, our New Heights computer eligibility system gets information from the Social Security Administration. It reviews that information, and it lets us know if there's anything we need to know about if a SNAP recipient had an increase or decrease in SSA benefits, or started receiving or stopped receiving an SSA benefit.
One final follow-up.
Final follow-up. Could you provide the committee with the language that specifically states that so that we can better understand exactly that?
Sure, we can follow up and elaborate on our written testimony.
Representative Weber.
And just so I'm clear about the SAVE program, SAVE, that is a program, am I correct in thinking that that's a program that only talks about the status of non-citizens? It doesn't verify information for citizens of any of this stuff. Is that correct?
So when I was doing research on the fiscal note, it did appear that that was correct, but it does seem like the SAVE system has been expanded to verify citizenship information. However, the FNS rules still require that we only verify citizenship when questionable.
But I keep hearing people ask if the SAVE system would help with some of these other verifications. And it's my understanding, if I'm correct, that the SAVE system is only about citizenship. It's not about any of the other qualifications that need to be verified.
I honestly can't answer that because
Okay.
we've only used SAVE to verify alien eligibility status.
Okay.
So whether it could be used more broadly, I just cannot answer.
Okay, thank you. Fair enough.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my other question. So about fiscal note and $842,000 of costs to build the waiver. In previous testimony, we heard that some other states were able to lower the cost by cooperating with some universities to demonstrate the need for the waiver. Do you think we can do something like that in New Hampshire?
Yeah, so there is an option to enact a healthy choice waiver, or implement rather, through the retailer level, where that would not have a cost to the state, essentially, except for probably customer service components that we would anticipate a minimal cost for. But the retailer level essentially shifts the responsibility, the work, the setup, the implementation, changes in their systems and then the coding of the respective items or recoding of items, that is all would lie on the retailers. We have about or over 1,050 retailers in the state of New Hampshire who participate in the SNAP program. So that would impact those particular retailers.
Follow up.
Thank you. It's helpful. But also, I wanted to know the building waiver itself. Currently, I think the idea is like it will be built inside the department, but alternative idea that was offered that part of the work would be maybe done pro bono by, I don't know, University of New Hampshire or somebody else to make the cost of building the waiver much lower. Do you think it's possible?
Oh, thank you for that question. So I would say that if we were to require the assistance of an outside source to build the waiver, it would require an appropriation to work into an agreement with that particular source and contract with them to do the work.
Anyone else? Representative Brew.
Thank you, Mr. Chair. So, looking at the fiscal note again, this is the EBT vendor option. That's the first bullet point. The department anticipates that it will cost $416,000 to facilitate retailers' adoption of the new waiver rules. So, if you were implementing the EBT vendor option, why would you need $416,000 to facilitate work with retailers?
And I will answer that by describing that when the fiscal note was prepared originally, we were looking at that as the option that was available to states to implement. Upon further research and information from the federal government and other partners and other states and what they're implementing, we came to realize that the other option is to continue with the current use that we have in place now, where all of that functionality and responsibility is the retailers. The retailers work directly with the federal government. It is between the retailers and the federal government who have agreements that the department is not involved in to set up the proper coding and implementation of the SNAP system, if you will. The department does not receive any data right now on what people purchase. So there would be the possibility that if we went by way of the vendor, the EBT processor rather, that we would be having to enforce that by way of analyzing data and information about specific purchases. But if it's done at the retailer level, it's coded at the retailer level, and that at the point of sale basically captures whether an item is eligible to be covered by SNAP or not eligible to be covered by SNAP. I hope that answers your question.
Follow up.
Not exactly.
Okay.
So, are you saying that the $416,000 would not be part of the EBT vendor option anymore, or it's needed to get data from the retailers in order to enforce the EBT vendor option? If I'm understanding what you're saying correctly?
No, and I'm sorry that I'm not being very clear. If we went by way of the EBT processor level changes, that's where the fiscal note has captured a cost of about $1.4 million. If we go by way of implementing this at the retailer level, there is no cost to the state of $1.4 million.
One more, final one.
So the $416,000 doesn't apply in either case anymore?
The $416,000 is part of the 1.4 total that it would include. It includes the enablement with retailers, all done by the EBT processor. System changes with the EBT processor. That's the $842,000. Transaction fees, retailer certification, retailer implementation, and automated customer service fees and charges through the EBT vendor. So without going through the EBT vendor, none of those costs would be required by the state.
Representative Weber.
So I have so many questions. I'm trying to figure out which one I want to go with. Is it correct that because of the reciprocity that's required, no, I won't go with that one. I'm concerned with the area of food deserts, which we have, and cross-border sales, where sometimes the only available food sources are either in our state for the other state, which is my town's situation, or going the other way. So how do you deal with the issue of somebody who regularly has to buy their food in the next state because that's where the grocery store is, as opposed to the people who are contemplated by the situation at the end, where clearly we don't want to be nobody wants to be providing benefits to anybody who doesn't live in this state. So how do you distinguish between the people who are shopping in another state of necessity?
So currently we would manually look at out-of-state data use, EBT use, in a data report. And if we saw that there were months of, typically 2 months of using it out of state, we would look for a little bit of nuance. And typically we would look for, does this person reside in a bordering town? And if they do, and they're just using it the next town over, we would not consider that to be questionable and not request any additional verification. So under our current process, we might look at it, check that it's a neighboring town, and not do anything further with it. We would also look at things like if a person's disabled and they have a rep payee in another state that brings them groceries, then we wouldn't consider that to be questionable that the EBT card is used out of state.
Weren't there automatic alerts at one point too if it was being used out of state on a prolonged basis? The EDGE system or something?
Yes, I believe that the EBT processor receives that information. And I can elaborate a little too. I mean, if we identify that somebody was using the card in California regularly over a 2-month period, of course, that's a red flag and we would follow up on that. But as Attorney Clark described, really just over the border in a rural area, maybe the only store that can get to is across the border. So we would certainly look into that, but it would not raise concern.
You have a follow-up?
It's another question, but yeah, thank you. So I'm understanding that of the 2 possible ways of implementing the candy and beverage waiver, that one would be the EBT card level and the other would be the grocer's level. Would you be concerned if we implement the EBT grocer level, implementation at the grocer level rather than the EBT level, which I understand would then be looked at and supervised directly between the grocers and the federal government? Would you be concerned that grocers might simply drop the SNAP program because of it being more of a pain for them?
Sure, thank you for that question. I think it's entirely possible. I think that you have some of the retailers who are like mom and pop type stores who don't have the ability or the funding to make upgrades to their own systems so easily. So you've got smaller stores who may not have the resources to recode so many particular items, and there's probably hundreds, if not thousands, of items that could be subject to being recoded. So I think that there may be some who would question whether or not it's a program that they would be able to continue participating in.
Thank you.
Okay, I think we're done. Thank you very much.
Thank you.
How many pages was that?
8.
Also signed up to speak is Kevin Daigle from the New Hampshire Grocers Association.
Thank you.
Good afternoon. Nice seeing everyone again.
Good afternoon.
Mr. Chairman, members of the committee. For the record, my name is Kevin Daigle. I'm president of the New Hampshire Grocers Association. We represent both chain and independent grocery and convenience stores here in New Hampshire, all who operate on razor-thin margins. Testified before you yesterday on a similar bill, so in respect of your time, you have written testimony. I won't go into the actual details. What I'll do is I'll hit some bullet points and then address some questions that were asked the previous speakers to issue some comments there. So as I said, we appear today in opposition. Our concerns with this bill solely focus on the SNAP waiver and product restrictions portion of the bill. Focus, on the costly compliance burdens for retailers, the possibility of reduced food access if retailers should stop accepting SNAP, the impacts on cross-border sales, and finally, the bill fails to improve diet or health with a product ban. Policies focus on incentives and nutrition education have proven to be more effective and less punitive than bans. Representative Markle, you asked a question right off the get-go about the 18 states that have been approved of their waivers. So to date, 5 states had an effective date of January 1st. Iowa, Indiana, Nebraska, Utah, and West Virginia. None of those were given a product restriction list. They had to come of it of their own. Oklahoma started February 15th. The only state to date that came up with a product restriction list. Previous speaker mentioned that there was a 120-day compliance for the federal government for everybody to get it right? Those first 5 states, there were many stores in those states who had told my colleagues in those states and others with the state agencies that they wouldn't meet that 120-day date to comply. They're looking now as whether they're going to try and continue and see if they can get it to 180 days, 200 days for compliance, or just drop SNAP altogether. One of the speakers before me mentioned this bill is perfect. It aligns with nutrition. Banning soda and candy is going to align with nutrition. The problem with this bill and every other bill, the bill testified yesterday, there's no metrics for measuring health. How do we know that banning a soda or a candy bar, and what is a candy bar? I went through the, equation yesterday of a Twix, peanut butter, peanut M&Ms, Snickers, Milky Way. Which one of these 4 isn't a candy bar based on the composition of it? Bans don't work. Incentives like food for medicine, healthy incentives, those work. Retailers are doing this now, but if we could, multiply what they're doing to get nutritious foods in front of these folks, that would work a lot better. If you bear with me for like 2 more seconds, I'll get through. Cross-border sales was one that was brought up. The sales from our folks having a ban doesn't, as other speakers have said, won't restrict those people from going to other states, because where the sale is made is where that transaction takes place and where the benefit occurs. So New Hampshire people who have a ban can go to a neighboring state either because it's closer or because the store has simply chosen in their own state to no longer accept SNAP, creating a food desert of sorts. I'm going to cross the border and now utilize that benefit that you're paying for. Previous speaker mentioned, Nielsen has created a POS system that it's a subscription service. You can buy it monthly, quarterly, semi-annually, annually. That's great. That's still a cost for compliance. Large retailers, sure, it may work with their POS systems, a simple download, and that will work for that time. What about the small mom and pop? Guy that doesn't have a POS system. And you laugh, but retailer tobacco reporting was brought into the fray late last year for retailers. You wouldn't be surprised how many retailers don't have a POS system. They've got a cash register, they're doing everything manually. Some of them don't even have Microsoft Excel. They had to buy a license to go. I was shocked. Some of these are chains that have franchisees and corporate stores. They don't have Microsoft licenses.
If you could please wrap up.
Yep. So subscription service is great. Doesn't do anything for small mom and pop because they're not going to buy into it. So they're in the same predicament they would have been in before. So as mentioned, we're opposed to this for the very many reasons. We hope you find this bill inexpedient to legislate, and I'd be happy to answer any of your questions.
Thank you. Any questions? Representative Drew.
Thank you, Mr. Chair. So the SNAP program already has an exclusion list, correct?
They do, correct.
So if these small mom and pop stores don't have a POS system, how do they implement that list?
So those exclusions are alcohol, tobacco, hot prepared foods. So typically what you're seeing at a grocery store, convenience store is simply that. It's registered as alcohol, tobacco. It's considered prepared foods for the sake of rooms and meals tax. Those folks have to pay tax on those foods. Everything else is delineated as grocery. So now I've got to take those thousands of items that are in that grocery category and now go through and figure out if it's eligible or ineligible. That takes man hours if I don't have it. Even if you have the POS system that does that, you need to continue to do it. New products come out, reformulations of similar products, and you still need to go through that exercise.
Follow up.
Thank you, Mr. Chair. Would it be fair to characterize the fact that grocers go through that process all the time as their product mix changes and products arrive and leave the shelves?
To deem a product eligible, ineligible? No, they're not going through that.
Speaking generally of changes to their list of products and their point of sale system if they have one.
Yeah, I mean, you're not changing your pricing on a weekly basis. I mean, most prices get changed when they get changed on a weekly basis. Your turnover is probably 5-6% a week for sale items, so they're going through that. But they have to go through every product that's coming in now. That's an added workload, definitely.
Representative Weber, did you have your hand up?
I did, but I
Okay. Representative Markell and then Representative Palazzo.
Thank you, Mr. Chairman, and thank you for taking my question, sir. So it would be fair to categorize it that you're going to lose out-of-state business from people who come from Massachusetts and surrounding areas to buy groceries in New Hampshire because the products that they can buy regularly in their home states, and they normally shop here for a variety of reasons. The grocery industry as a whole would lose business. Is that correct?
That is a very good assumption. DHHS is going to make a very good, if this happens, educational output to their recipients. You're a Massachusetts, we'll say, use Massachusetts as an example. There's going to be no education on their part. They're now going to come to this store. They're going to be told, nope, that doesn't work. So it causes frustration with the customer, causes a scene. Part of the education process for retailers from DHHS is to not make the SNAP or WIC recipient someone that's noticeable. It's going to be a transparent type of transaction. So now you're bringing this out. Me as a customer, I'm not going back to something like that.
Thank you. No further questions.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. I don't know if you're ready to discuss on a technical level, but I think in previous discussion we understood that there are two ways to implement these restrictions. One is on EBT vendor level and another one on a retail level. It sounds like EBT vendor level would be more expensive to the state, but it seems like the bill sponsor wants to go that way. But it sounds to me like your testimony speaks about restriction on retail level. Correct me if I'm wrong, and also like if you can compare those two ways, would it be more less expensive for your clients if the restriction is on EBT vendor level?
can speak to some of that. The cost for us at a retail level, you're going to have man hours, you're going to have upgrades to software, in some cases the purchasing of software. That shouldn't be on us. As to what the cost would be in a hypothetical EBT vendor scenario where it's already been said they don't want to go that route, I can't speak to that cost. I would say if you're looking to do something other than a retail level restriction, you look at incentivizing nutritional behavior.
Other questions? Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking my question. Can you just speculate on what you think the effect of this will be on grocery prices?
Well, like anything, those costs will be downshifted to the consumer. We absorb as many costs as we can. Early on, a few years back, when you saw the price of eggs and meat was skyrocketing, retailers held on to that pricing as long as they could before they had to pass it along. A cost like this will definitely be downshifted to the consumer.
Anyone else? Okay, thank you.
Thanks, sir.
Also signed up to speak is Heidi Johnson from the New Hampshire Food Bank. You asked for 4 minutes. Try to keep it to 3 if you can.
You could turn on your microphone.
There we go. Good afternoon, Chair McDonald, Vice Chair Mazur, and members of the Health, Human Services, and Elderly Affairs Committee. My name is Heidi Johnson, and
Yeah, could you move your microphone up a little bit?
is that better?
Yeah,
Ooh,
you
that
can
is better.
you can pull it down towards you if you want. That might be a little more comfortable. And did you have written testimony?
We do. Do you want that right now?
Yeah, if you could just leave it at the end of the table, we'll pass it down. Thank you very much.
Good afternoon. As I said, my name is Heidi Johnson, and I'm the coordinator for the SNAP Outreach and Application Assistance Program at the New Hampshire Food Bank. And thank you for the opportunity to testify against the House Bill 1797 today. As you may know, the New Hampshire Food Bank is the only food bank in our state. We purchase food and we receive food donations from retailers. And then we distribute that food to our over 400 partner agencies throughout the state, such as your local soup kitchens, food pantries, boys and girls clubs. In 2025, we distributed 20 million pounds of food. That's equivalent to over 24 million meals. Yet this fell far short of supplementing the need for our neighbors who are experiencing food insecurity. According to Feeding America's 2025 map, the meal gap, 1 in 9 Granite Staters and 1 in 7 children are food insecure. These are all of our neighbors you might not suspect, who don't have the funds to purchase the quantity or quality of groceries they need to stay healthy and strong. I'm talking about diabetics who have to choose between buying their meds or buying fresh produce. Elderly and disabled who choose between using their stove, their lights and heat, or buying meat and vegetables. Or the little old lady who told me she could get by just eating crackers and cheese for each meal so that the single lady down the street with 3 children could have SNAP. Or the octogenarian who told me, Heidi, I didn't know I'd live this long. This past November, when the New Hampshire Food Bank served as the SNAP contingency plan for the state during the federal government shutdown, we distributed the equivalent of 136,610 meals in 2 weeks to SNAP recipients through our mobile food pantries and our partner agencies. Many of these individuals could again lose benefits to SNAP if HB 1797 passes. This would include children who could lose eligibility for free and reduced priced meals that are guaranteed for them if their families receive SNAP benefits. Another grave concern is that the rollback of gross income limits would restrict the number of people who can apply for benefits, people who very well might otherwise meet the net income limit. Additionally, the bill's reversion to strict asset limits would disqualify families who had previously saved a $3,000 or more rainy day fund. For these families, one unexpected need for a security deposit, car repair, a medical emergency can send them into a crisis that forces them into our soup kitchens. An enormous load that we cannot support. So these restrictions, eligibility cuts, and added costs will increase hunger, stigma, and administrative burden without better health concerns. And therefore, we do respectfully urge you to oppose House Bill 1797.
Thank you. Representative Drew.
Thank you, Mr. Chair. Does the food bank accept donations of soda or candy?
I don't know the answer to that, but I can find out and let you know.
Other questions?
I've seen candy before. I'm not in that department.
Other questions? Seeing none. Thank you. Also signed up to speak is Ray Burke from the New Hampshire Legal Assistance. This person left. Okay. Also signed up to speak is Michael from United Way. Appleberg, is it, or?
Yeah, Appleberg. Do I get Mr. Burke's time too?
No, just yours.
All right, fine. Thank you for having me today and for the opportunity to speak to you. My name is Mike Affelberg. I serve as the president of the United Way of Greater Nashua. We work every day with families who rely on SNAP to stay fed, stable, and able to work. Our organization is strongly opposed to HB 1797 for a number of reasons. It adds administrative burdens, it removes needed flexibility, and it will result, in our opinion, in more families losing benefits despite being eligible. First of all, HB 1797 requires that DHHS create new verification systems and data arrangements. That will slow down application and recertification processing times. That's not speculation. We know this from national evidence. These kinds of burdens cause harm. For example, in 2025, an Urban Institute study found that 24% of working age SNAP recipients had their benefits interrupted, and 13% lost benefits because of recertification problems, such as not receiving notices or not having time to respond. Another multi-state survey showed that about 1/3 of SNAP recipients struggle just to understand eligibility rules, and 1/4 face documentation hurdles. When we read these findings, I immediately thought of a local mom who I met at one of our partner food pantries in the Nashua area. She works full-time in a nursing home, but her schedule changes constantly. Her SNAP benefits were cut off last year, not because she didn't qualify, but because her recertification letter, went to the wrong address. For weeks, she and our 2 children relied on emergency food boxes. Thank you to Heidi. When the system makes it this hard for a working parent, adding more steps will only make things worse. Secondly, the bill removes DHHS's flexibility to adjust eligibility and exemptions to meet local conditions. Families in Greater Nashua often have changing hours, seasonal work, and fluctuating income. Without flexibility, even short-term changes can cause families to lose benefit, deepening food insecurity. Third of all, HB 1797 prevents New Hampshire from seeking federal work requirement waivers for able-bodied adults without dependents, even when jobs might be scarce or hours are unstable. A 2026 National Bureau of Economic Research study found that the work requirements significantly increase procedural denials, meaning people lose benefits because of paperwork, not because they refuse to work. One of our local meal program volunteers is a perfect example, and I'm almost done. He worked construction, but with inconsistent shifts and weather delays, it meant he couldn't always document enough hours. A temporary waiver helped him keep food on the table while he looked for steadier work. Without that flexibility, he would have fallen through the cracks. Finally, research shows that agency understaffing increases administrative burdens and delays for families trying to enroll in SNAP or other programs. For all of these reasons, our organization respectfully urges you to find this proposal, HB 1797, inexpedient to legislate. And thank you for your time.
Thank you. Very good. Any questions? Saying no questions. Thank you, sir.
And I brought all of 3 copies with me.
I want one.
She needs 2.
She can have
No,
all
I can take one. It's okay. Wow. Thanks.
Thank you. Also signed up to speak is Carrie Duran from Wolfboro.
Is it on?
It
great.
is, yeah. As
Great.
long as the red light is on, it's on.
Thank you. Good afternoon, Chairman McDonald and members of the committee. Thank you so much for the opportunity to speak today. I had not intended on speaking today. I was here to learn about the bill and get some questions answered for myself. Again, my name is Carrie Duran. I'm from Wolfboro. For the record, I am the legislative liaison for Lakes Region Community Services. We serve adults and children with developmental disabilities. But today I'm testifying before you as a mom and a former SNAP recipient. I just wanted to bring a face to the folks that you're talking about, the folks that we're making decisions for today. I wanted to share with you that I am a single mom of 3 girls. My twins are 19, they're in their 2nd year of college, and I have a daughter, Katie, who's 1st year of high school, who was born with a developmental disability of Down syndrome. Due to her medical issues and constant trips and visits in the hospital, I was unable to work as I was a full-time caregiver for her and caring for my other daughters. I relied on the SNAP benefits. I relied on our local food pantry to fill in those gaps. My girls had free and reduced lunch, and we all received Medicaid benefits. I had Medicaid as well. As you can imagine, for many parents who are relying upon these benefits, the burden of paperwork is it's unsurmountable. I have never done so much paperwork in all of my life. I also live in lower income housing in Wolfboro, so I recertify every year for housing, for healthcare, for food, for my family. And over the years, yes, I've gotten a lot better at it, but there's a lot of families that don't have access to a computer or an internet, and we can no longer go to DHHS to their office because there aren't employees there at our local offices to say, hey, I need help filling this out. There's just a lot of folks that fall into those concerns. I wanted to share with you, too, that not once ever have I ever purchased soda or candy with my EBT benefits, not one time. And I know that you have studies and data saying that that happens, but there's so much training and education that I received from DHHS when I received my EBT benefit. From our local food pantry, when I would go there, they would offer recipes. Hey, this is all the wonderful food we have. Here are recipes and what you can make with it. And sometimes before COVID, we'd have cooking classes that would help us. There was a lot of education and support to help me and my little family to make nutritious meals and make sure they were eating healthy. So I just wanted to share a face. I don't have a bunch of data in front of me. I just have my personal experience and how grateful I am to have had that support. And I just want to say really quickly, it took me 20 years to get off of services. I'm sitting in front of you today as working full time for the first time since I was pregnant with my twins. And it took me 20 years to get over that benefits cliff to making working full-time possible, and with the help of my daughter too. So I'm grateful for those benefits, and I just hope we won't make it harder for families like mine to receive those benefits and benefit and have kids in college and healthy children. So,
Thank you.
Yeah.
Any questions? Okay.
Thank you so much.
Also signed up to speak is Aubrey Friedman from Bridgewater, New Hampshire.
Mr. Chairman, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. I'm glad to hear that, one of the intents of this bill is to tighten up, the spending of government, taxpayer funds. We want it well spent and to go to the people who it was intended for, and not to people who are gaming the system. So that's a good thing. I was kind of shocked to hear like 7.5% and like Alaska like 24%. That's like outrageous. I mean, if it's going to be taxpayer money, it should be, well regarded and not wasted. So I think that the things that have been built in this bill are good to verify before giving out taxpayer money. And I've never met a government program that didn't have fraud. So if there is no fraud, then nobody will be hurt by this system and benefits won't be denied. But obviously there is some, so it needs to be found out and cut. I mean, that's, so that's the intent, one of the intents of the bill. The other part about the candy and the soft drinks, to me, is rather obvious. Taxpayers should not be paying for free candy and soda pop. So that's just, I'm sure people will find a way to get it, but that's just not something taxpayers should be paying for. So that makes sense to me. And then when it comes to the work requirement, living on government handouts, the incentive here, when you have getting handouts, it actually breeds poverty, and it disincentivizes providing for yourself and your family. So I think this bill moves it in the right direction, which is we should encourage families to be independent and responsible, personal responsibility for taking care of your family, not being dependent on others. So the incentive is correct as far as I'm concerned, and that's why I support the bill. Thank you.
Thank you. Representative Palazzo.
Thank you, Mr. Chair, and thank you for your testimony. You mentioned some potential savings that this bill will bring, but would you still support this bill if, at least temporarily, it will increase spending and thus taxes, because department asks somewhere about $1 million to implement those new guardrails?
Well, I'm not for more government spending, but if you're going to have government workers, implementing a program, and it is with taxpayer money, then you want it done properly. And from listening to the testimony, it seems to me I can't see why a lot of that shouldn't be automated already. We're in the year 2026, so I just can't see, sometimes you have to spend some money to save money. But I would think in the long run, 7.5% is outrageous. So, yes, reluctantly, I would support spending some money to do the program. If you're going to have it, you've got to should be zero fraud or zero mistakes for sure. So reluctantly, yes.
Representative Weber.
Thank you, Mr. Chair, and thank you for taking my question. So with the department being under the requirement to cut $51 million from the budget that was already cut before they were finalized, where would the money that you have to spend money to save money come from?
Well, it should be that should come from the savings of cutting down on the fraud or the the mistakes and stuff. I would assume a lot of the 7.5%, like was detailed, it could be underpayment. I'm not so concerned about underpayments because I think people will let you know if they're not getting what they're supposed to. But the overpayments, so some of that I would think a good part of that would come from cutting that 7.5% down.
Follow up.
So my question really was, in a state where many, many departments are already operating with very, very elderly technology systems, where does the money that has to be paid up front in order to save the money come from?
Well, if you have to invest some money, as was mentioned in the, like I say, I'm not for spending more money, but if you have to do it up front, then you've got to put it in there. And I guess it would have to be in the state budget. Again, for the goal of cutting down on that 7.5%.
Other questions? Seeing none. Thank you, sir.
Thank you.
No one else has signed up. No one else has signed up to testify on this bill. Does anyone else wish to testify? Seeing no one, I'm going to close the public hearing on HB 1797 FN. That concludes our business for today. It also concludes all of the hearings on any House bills we had for this year. We will be having an executive session next Wednesday beginning at 9 a.m. We stand adjourned.